Tomorrow, everybody. It's Jamie Thomas here from Way Up at Work, and welcome to the Dental Health Service Victoria's online conference. I descend from the Gunai people of the western part of Victoria, and I also want to honour my grandmother's country and my children's country, the Pequodong speaking people of the Maan Nation. What I'm going to do today is an acknowledgement. It's an acknowledgement of Mother Earth and all that she does and provide for us. An acknowledgement of the traditional custodians in which you are seated and sharing this conversation and yarn today, and also acknowledge yourselves, your families and the ancestral lands in which your ancestors come from to be with us today. What I'm going to do is just quickly light a small little honour bowl here that I do before every yarn, every acknowledgement, and it is about honouring our ancestors. Our ancient ancestors that sat around and lit a fire for warmth, for cooking, and also for sharing stories. So honouring all of our ancestors and honouring Mother Earth for the gifts and gratitude that she provides. Matamangatuk maluka tangganay. Kere warang cepelong liria mereng, wangurucung warang alamin, wangurucung warang mara, wangurucung warang mereng, wangurucung ngereng mereng, wangurucung ngereng mereng, mara ngamaji. Ngatamwa ngereng mereng, warano malu. Warano malo katangalannya para matamwa maralami wangano chong mereng mara wangano chong mara namaje. Wanganuchung laka, wanganuchung mereng, nguchung yanaki. Uruk and Woman India, everybody. Have a great conference.
Good morning everyone, and welcome to the 2021 Public Oral Health Innovations Conference. I'm Zoe Wainer, the Chair of the DHSV Board. As we gather for this conference from various locations, I would like to take a moment to reflect on the meaning of place, and in doing so recognise the traditional custodians of the land on which we stand. We acknowledge the elders, past, present and emerging, of all the land we work and live on, and offer our gratitude and respect in the spirit of reconciliation. This is the second time we have run our Innovations Conference as a virtual event. We really look forward to seeing you all face to face again next year. We are delighted to have the Minister for Health, the Honourable Martin Foley, join us via video. The Department of Health has done an impeccable job of keeping Victorians safe under what have been immensely challenging circumstances. We know how busy you are, Minister, and are so grateful that you have taken the time out of your day to support this important event. Your presence demonstrates the Department's ongoing commitment to improving the oral health of Victorians, and your support is appreciated by all of us working in the sector. We are pleased to report the Smile Squad, also affectionately known as Dan's Vans, are back on the road delivering free oral health care to Victorian public school students. This delivers on the Premier's election promise to make oral health care more accessible and affordable for Victorian families. We thank him and everyone at the Department of Health for prioritising oral health care and wish Premier Andrews a speedy recovery. The theme for today's conference is Leadership Matters, and I couldn't think of a better focus given what we've all experienced over the last 12 months. The pandemic brought with it fear and uncertainty, and everyone dealt with that in their own way. The challenges we've faced have accelerated the move towards more empathetic and connected leadership. Not only have we had to rethink the way we operate, we've also had to rethink the way we communicate and connect with one another. It's highlighted our humanity and shown us that people are and have always been our most valuable asset, particularly in healthcare. Over the past year, our staff have stepped up and proved that our values of respect, accountability, collaboration and transformation aren't just words, they're part of our organisation's DNA. Staff at community dental agencies across the state have also excelled, providing forward-thinking, quality care to the community despite the many challenges. What has leadership looked like at the board level over the last 12 months? The core focus for the board has been safety. We made a decision early on that nothing would compromise the safety of our staff and our patients. In the oral health sector, we had the benefit of being able to suspend non-urgent services. Each service was given a risk rating and we took a fastidious approach to protocols, including PPE. With many of our services shut down or operating at limited capacity, we made great strides in the area of digital innovation. By expanding the rollout of teledentistry, we were able to continue to provide oral health care to Victorians without compromising safety. On behalf of the board, I just want to say how impressed we have been with how everyone, both at the hospital and at community dental agencies across the state, responded to the pandemic. You showed us that leadership doesn't just come from a board and executive team, it comes from all of you. Leadership is integrated into how we think, how we operate, and how we come together to deal with adversity. Leadership is a value that ensures we keep evolving for the benefit of each other and the community. We have made big advancements in so many areas and I look forward to us keeping up that momentum as we create an oral health system that is flexible, fit for purpose, integrated, technologically advanced and focused on the outcomes that matter to patients. At DHSV, our leadership goes well beyond the realm of healthcare. At the moment, Australians are calling for a decisive leadership to stand out gendered abuse and ensure that women are kept safe at home and at work. On behalf of the board, I promise that we will continue to push for a more gender equal world, a world in which women feel respected, heard, believed and safe. Today we have a strong lineup of female presenters who are going to share their expertise across a range of topics. Emma King, CEO of the Victorian Council of Social Services, will talk about leadership for those without strong voices. Suzi Finkelstein, CEO of Women Leadership Australia, is going to host an interactive workshop on developing leadership skills. We will also be joined by Sheena Watt, the first Indigenous Labor woman in the Victorian Parliament, who's going to talk about her experience being a leader within the Indigenous community. Thank you for joining us today. I hope that the conference inspires you to think outside the box, to try something new, and to lead the way in improving the oral health for Victorians. And thank you to everyone working in the public oral health sector for your dedication and commitment, especially over the last year. We see you, we appreciate you, and we acknowledge your outstanding contribution to the community. I'd now like to hand over to the Victorian Minister for Health, the Honourable Martin Foley, who is going to officially open this year's conference. Thank you.
I would like to acknowledge the First Peoples and traditional owners of this land. I pay my respects to their elders, past and present, and to all elders who have joined us here today. It is my great pleasure to open the 2021 Public Oral Health Innovation Conference. The theme for this year's conference is Leadership Matters. The last 12 months have provided a powerful reminder of the importance of leadership in ensuring effective, evidence-based responses to public health challenges. Great leadership has been shown across our health system in response to COVID-19, but I would like to take a moment to recognise the role taken by our lead public oral health agency, Dental Health Services Victoria. In December 2020, DHSV received special recognition from the International Hospitals Federation's Beyond the Call of Duty for COVID-19 program. Congratulations. I would also like to acknowledge the leadership of each and every one of you, our oral health professionals, in continuing to offer the very best care to your patients in the most difficult of circumstances over the last year. We understand the importance of oral health to a person's overall general health and well-being. The pandemic response has caused significant disruption to our health system. But now, as we return to COVID-safe settings, it is up to all of us to help to ensure that Victorians are able to get the help they need when they need it. That's why the Victorian Government is investing $319 million in 2021 to fund the dental health program. This will provide dental treatment to over 330,000 eligible Victorians this year and enable DHSV to deliver the school dental program, also known as Smile Squad. The 2021 funding also includes some $2.3 million to promote the oral health of Victorians in DHSV's statewide prevention initiatives such as Smiles for Miles, Healthy Families, Healthy Smiles, and oral cancer screening and prevention programs. Victorians require access to high-quality public dental programs, particularly those who need it most, no matter where they live. Together, we will provide these programs. Thank you all for coming together today to share ideas on how to more effectively support Victorians to improve their oral health.
Thank you, Minister Foley, for opening this year's conference. As Zoe mentioned, we very much appreciate the support from the Department of Health as we strive to improve the health of all Victorians. I too would like to acknowledge the traditional custodians of the land in which we are all meeting today and pay our respects to elders past, present and emerging. So good morning everyone and welcome to the DHSV Public Oral Health Innovation Conference, Leadership Matters. We launched this annual conference in 2012 because we wanted to provide a platform for people to showcase the great work happening in the public oral health sector around the state. We have participants from across Victoria, both from the public and the private sectors. We have interstate guests with us today, and we have people tuning in from all over the world, including the UK, Korea and India, just to name a few. If you're an avid social media devotee, you can follow us on Twitter and on Facebook, and the hashtags are above me on the screen. We are privileged to have a fantastic lineup of presenters today, so thank you everyone for agreeing to participate. For those of you who don't know me, my name's Sue McKee. I'm the CEO of DHSV. I took over this role in early 2020. Some might say I have very lousy timing, but I say that I actually have some great timing. I was thrown into the deep end with this pandemic. I'm actually really grateful for that, to be starting the CEO as the storm hit. I've learned a lot more about leadership in the last 12 months, and I'd like to share some of those lessons with you today. One of the key things I've learned over the last 12 months is that no one is an expert at leadership. We are all students and we are all learning every day. If anyone thinks they've mastered leadership, they're kidding themselves, because leadership is not a static thing. It's not something we learn and tick a box and say, I've mastered that, I'm done. It's something we have to reflect on every day. It's something we have to practice every day, so we can assess how we're tracking and how we can better lead cultural change and innovation. Leadership is always evolving. Just look at the last 12 months. We've had to completely change the way we connect with people. We've had to completely change the way we do things in different times. When I took in this role in January 2020, I thought I had it all sorted. I had a solid idea of where DHSV was heading, and I was champing at the bit to develop our new strategic plan and take the organisation to the next level. 2 months in, and the COVID-19 launched me straight into the deep end, and we had to rapidly respond to unprecedented times. And yes, I know everyone's thinking they're sick of the word unprecedented, and I promise I won't use that again today. I certainly didn't get everything right, but I gathered a great team around me, and we did our best to adapt and to keep everybody safe and informed. If I failed fast. Stewing over mistakes and mishaps is a waste of energy. It's important to absorb mistakes and then keep moving forward. Another valuable lesson, one that a lot of people have been talking about lately, is around empathy. Leadership is not just about setting expectations and ensuring people meet them. It's about taking the time to understand and connect with people so that they can flourish. The uncertainty of the last year has taught us just how important it is to put the humanity back into healthcare leadership for both our patients and our staff. A true leader recognises that people have full and often challenging lives outside of work or the dental chair. Empathetic leaders take the time to get to know people on a deeper level so they can tap into what motivates them and help them to be more engaged, happy and productive. They recognise that people have an inherent desire to do meaningful work, to have a voice and to feel like their contribution is valued. While we have a fair few people here today from the private sector, a lot of you work in the public oral health sector. In the public sector, we have set targets that we need to meet, and I think sometimes we focus on those far too much. Reaching those targets, we often forget to be empathetic and how to lead. A great leader gets people excited about the vision and the role that they can play in bringing people to life. Meeting targets is the byproduct of that. So if we focus on being empathetic and we actually focus on our vision, we will meet our targets, there's no doubt about it. The research tells us that a more engaged workforce is a more productive workforce. No matter what role you have, be it in the clinical area or administration, it's more important than ever that we demonstrate empathy. This doesn't always come naturally to us. I know at times I don't always get it right. So I'm going to show you a quick video that demonstrates the difference between sympathy and empathy.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
That's a fantastic clip there from Brene Brown. Have a think right now about the conversations you've had over the past year. How many times did you start a conversation with at least? When a colleague said they were struggling with lockdown, did you say, I know I did, at least you don't have to homeschool kids? When a team member said they were struggling with not being able to see their family, did you say, at least they aren't overseas? A lot of us fall into the trap of trying to get people to look on the bright side without realising that we're in fact completely invalidating their feelings. I'm not saying leaders need to spend all their time having hearts to heart. No, we do need to balance empathy with building resilience and getting stuff done. We also need to encourage people to maintain perspective. It's a fine balance. In the oral health sector, a lot of us have been shielded from the devastating impacts of COVID. I know many families that have completely lost their livelihoods and lost everything. While at DHSV, we were able to keep people in stable employment and ongoing employment, even with decreased capacity to do our usual work. Should we look at that and be grateful? Yes, of course we should. but we also need to be mindful of not discounting people's feelings, and we don't know what's going on in people's lives no matter how connected we are with them. We are all different and we all cope in different ways. The next lesson is that being a leader and being a manager are not the same thing. You don't need to have direct reports to be a health leader. Leadership is something that we can all practice every day. You don't have to have the role or a title of a leader to come up with a great idea and implement it. You just need to put your hand up. I'd like to see everyone in healthcare feel empowered and brave enough to step up and say, hey, what about that? I think this could make a big difference in improving health outcomes. Too many people never realise their leadership capabilities because they are too afraid to try. They think leadership is the responsibility of the board, the executive team or their manager. As leaders, also, we need to take the responsibility to build organisations where people feel safe to put their hand up and say, hey, I've got a great idea, but also feel safe to fail. The thing is, we want you to step up. We want to hear your views and how to create a more effective and purpose-driven, customer-centric oral health system. Managing people is not the same as leading. We all have the power to lead innovation, no matter what area we work in. If something you hear today inspires you to lead change, and I'm sure it will, speak up, share your ideas, and take the lead. As I mentioned before, leadership is about more than setting tasks and ensuring they get done. It's about thinking outside the box and supporting the people to be their best selves, whether they report to you or not. Which brings me to my next lesson. To be a good leader, you need to be incurably curious. And yes, that's a tongue twister. Don't try and say it fast 5 times. You can't just accept the status quo and go, oh well, that's just the way it is. You need to keep looking for ways to improve the way your organisation operates. That's what today's all about. By attending today's event, you're saying, I'm curious. I want to know more. I want to find out how I can do things better, how I can make a difference. You're already on your way to becoming a more effective leader. In the oral health sector, we have our work cut out for us. Oral diseases are largely preventable, and yet Australian children aged between 5 and 10 have an average of 1.5 decayed, missing or filled teeth. Australian children aged 15 and over have an average of 12.8 decayed, missing or filled teeth. As you all know, poor oral health is linked to a range of chronic conditions like heart disease, diabetes and dementia. Unfortunately, our messages aren't cutting through the way we want them to. And while we're making strides to deliver more patient-centric models, we have a long way to go if we want to actually make tangible, positive change. We have to stay curious. We have to be brave enough to get out on a limb and try new things. We have to be willing to shake things up. So, my final lesson for today. You don't have to know it all to lead it all. This one is specific for those of you who, like me, have to lead a diverse range of departments and multiple professional groups. As a CEO, I have to oversee people across clinical departments, corporate services, ICT, legal, supply, etc., etc. I'm certainly not an expert across all of these areas, but I don't have to be. I simply have to know how to lead and inspire people so they can do their best work. And that's about all the things I've mentioned before: staying curious, being empathetic and empowering people to take action. Too many people in positions of power get caught up micromanaging, and that stifles employees' growth and creativity. One of my favourite quotes is this one from Simon Sinek, who said, "A leader's job is not to do the work of others, it's to help others figure out how to do the work themselves, to get things done and to succeed beyond their expectations." It's impossible for a CEO like me to know all the intricacies of clinical work, and I'm not meant to. What I'm meant to do is to be clear about the vision so people can see what we're trying to achieve, and then give others the space and the trust and the motivation to do good work. Even if a problem or a challenge is in your area of expertise, it's still okay to say, I don't know how to do this. You have to stick to good decision-making processes rather than pretending that you know the answer to everything. Humble leadership enables you to bring the right people together and make the right decisions. Today I was tasked with talking about leadership in health, but the lessons I've shared today go beyond the confines of a hospital or a dental clinic. A lot of you attending today are women, and what's been happening to women in homes, workplaces and public settings across Australia and the world is not okay. All of us can lead change in this area, whether it's calling out misogynistic behaviour, pushing for more women in leadership positions, teaching younger generations about consent, we can all ambassador for more gender equal world. I'm challenging all of you to lead in this way. I hope my lessons on leadership have given you some food for thought. I hope that today helps us reassess the way we do things, be inspired by new ideas, and walk away feeling motivated to play our part in creating a healthier Victoria. Thank you to everyone who has made today happen, and thank you to everyone working in the public oral health sector for your dedication and commitment to improving the oral health of all Victorians. I'd now like to hand over to Emma King, who's going to talk about leadership for those without strong voices. Emma is the CEO of the Victorian Council of Social Services. As our keynote speaker for today's conference, Emma is going to speak about leading those without a strong voice. Emma joined the Victorian Council of Social Services as Chief Executive Officer in 2013, providing a strong voice of leadership and advocacy on social justice issues for the community sector. Emma was previously the Chief Executive Officer of Early Learning Australia. Emma has an extensive background in the public sector and in workforce and education issues, having worked as a Victorian policy advisor, a teacher, and in a range of industrial relations and training roles. Emma's qualifications include a Master's of Industrial Employment Relations, a Graduate Diploma in Education and a Bachelor of Arts. Emma represents VCOS on a range of ministerial advisory groups and committees. She's also President of the Farnham Street Neighbourhood Learning Centre and a board member of Mental Health Victoria and the Portable Long Service Authority. Emma is a regular commentator on social affairs and justice issues. So if that makes you tired, welcome Emma. Fantastic. We look forward to your speech today.
Thank you so much, Sue, for that very, very kind and warm introduction. If I can begin by, actually, I'm going to just ask the people I'm talking to, where would you like me to look? Because I can see a few cameras, and as we're all working in the virtual world, thank you so much. Always good to do a double check. Thank you. So if I can thank you very much for that very warm introduction, and also begin by paying my respects to the traditional owners of the land. I would like to acknowledge elders past, present and emerging, and of course acknowledge that sovereignty was never ceded. For those of you who've not come across the Victorian Council of Social Service before, I think Sue did a beautiful cover in her introduction, but we're the peak representative body and advocacy body in Victoria that works to eliminate poverty and disadvantage, but also works to create wellbeing for every Victorian and every Victorian community. Our members reflect the diversity of the sector, and they include large charities, small community sector organisations, advocacy groups, individuals. Basically, when it comes to looking at the for-purpose sector in Victoria, the whole gamut. We work towards creating a Victoria that's free from poverty and disadvantage. We do this through our advocacy work, through our policy development, through our capacity building, and through, really importantly, forging partnerships to affect change. And it's one of the really exciting things around being here with you today, because I think it's around the partnerships that we can all create collectively about working with community and working with people in how we continually impact and affect change. I do want to recognise all of those who are giving their time very generously to spend with us today and to listen to me. I want to recognise your expertise and the care that you give to Victorians throughout our community to give people the very best lives possible. As we all know, and I know I'm preaching to the converted here, we know that there's an incredibly strong and well-established link between poverty and poor oral health. Sadly, most of us are exposed to this at an early age by what we see on the big screen. If a filmmaker wants to signal that someone is poor or uneducated, they simply give them a few missing teeth or a pretty ugly filling. It's rarely the hero or the love interest that's missing a tooth. The stereotype is regressive and it is damaging, but sadly, it's not entirely based in fiction. A 2011 study from the Australian Institute of Health and Welfare tells us that kids from poorer areas of Australia have 70% more tooth decay than children who live in affluent suburbs. Aboriginal children have roughly double the rate of tooth decay compared to other Australian children. And the same study reveals that almost half of people living in poverty simply cannot afford to see a dentist. Since this study was done, we've had the global financial crisis, we've had a decade of stagnant wage growth, and we've also had a decade of price increases. As Sue touched on as well, in terms of looking at the impact of COVID on our whole community, we're currently bracing really for the COVID recession, and I'm sure many of you feel like you've well and truly been in that as it is. Our federal government is also about to cut the rate of support for people who are out of work. And so for those who are, in addition to those who are out of work prior to COVID, the end to JobKeeper on Sunday is going to hit people incredibly hard. At last count, almost 400,000 Victorians were dependent on JobKeeper, and we know that the scheme ending is going to be devastating. At the same time, we've got job seeker rates that are being cut, forcing thousands of Victorians to live in abject poverty. We know that is going to have a very real and a very immediate impact on people's ability to look after their teeth and to be able to see a dentist. And we also know that if that study were done today, that the results would be considerably worse. So that, to be candid, is alarming. Australia should not be a country where someone can't chew because they're poor, or they don't want to smile because they're poor, or they develop other health conditions because they're poor. We assume that everyone knows about good oral health, but not everyone does know what that means. And in terms of what I'm about to say now, I don't want to be categorising everyone because they're poor to suggest that they don't have good literacy or that they're not intelligent in any way. That is not what I'm saying, but I am drawing on evidence that talks around issues that pertain to literacy and other things as well. So we know roughly 1/5 of Australians have very low literacy. They struggle to read books, newspapers, or signs on the wall. They couldn't read the program for this conference. More than half have what's called less than adequate health literacy. And if you're poor, or you didn't finish school, or you don't have a job, you're more likely to have poor health literacy. And again, people with low health literacy are less likely to get preventative care or early treatment. They're going to appear in your waiting room, as you probably well know, when they are in terrible pain or when they are incredibly sick. And that's assuming they're able to access your waiting room at all. They may not know about links between diet and health, but again, I don't want to make assumptions about that, but we know that there are trends to that effect. Or they might be reliant on food relief or a limited budget, and they have very little choice in what they're able to eat. We know that so many people simply don't go to the dentist because they just can't afford it. If you're struggling to get by on about $40 a day, because your so-called choice comes down to really, do you put food on the table? Do you turn the lights on? Do you turn the heater on? Do you buy shoes for your kids? Or do you go to the dentist? And really, it's not much of a choice at all in terms of the things that you're forced to be able to do. And as a side note, we know that it's actually generally cheaper to feed your kids Maccas for dinner than it is to actually be able to go and pay for a really good, healthy, nutritious meal, which is a whole separate issue that really and truly needs to be addressed. So to recap, there's so many people with very little money, limited choices, often limited literacy, and who may lack a good understanding of their health. It's what can only be called a toxic mix. There are many other groups or backgrounds that can affect people's oral health, and I just want to touch on a few. So maybe you're a casual worker. COVID-19 only amplified how difficult it is for those who are in casual work. Low paid and insecure work makes it really hard to take time off if you're sick or if you have an appointment. Isolating for days, as we know, was nearly impossible for people who are trying to pay the rent and to keep the fridge stocked. Workers say they need to be flexible and they need to be available for their employer even when they're not on shifts, because if they get called in at short notice, the reality is they risk losing their jobs if they don't turn up. If you have a choice between keeping that dentist's appointment or losing your job, well, it's a pretty simple choice, or not really a choice at all. Disturbingly, what we're also seeing is a significant increase in not only unemployment, but also underemployment and in the growth of casualised and precarious work. So this problem isn't going to go away anytime soon. Maybe you grew up in the country, as I did, but many other low-income people do, where water isn't fluoridated. Still today, we know that more than 300,000 Victorians do not have access to fluoride in their water. I don't need to tell you how beneficial fluoride is for teeth and the consequences of being denied this treatment. Maybe you're a recently arrived migrant or a refugee. Many people who are new to Australia come from countries that don't have decent dental care or a culture of good health hygiene. A newly arrived refugee told one of our member agencies, and I quote, "I've never seen any dental in my country, so never, no treatment. So when I come here in my first 2 years, I have to talk to the dentist and have my checkup, and I say, okay, but I feel really nervous. I'm not sure what to do, and I say, I'm not used to this." Maybe you're a person with a disability. People with disability and mental illness often have poorer physical health, including oral health. Medication, financial hardship, and a range of complex health problems, stigma and fear can all contribute. But as you know, dental clinicians who take the time to communicate directly and build a relationship with people will achieve much, much better outcomes. It's so important to think about the different ways of communicating, such as working with an interpreter or using visual aids, as I'm sure many of you do. Or your patient might just need more time. They might need a longer appointment, they might need more explanations. To pick up on this theme, I want to play you a video from a VCOS member called Inclusion Melbourne. This video looks specifically at the barriers that dentists and those with an intellectual disability may face and may navigate during a dental visit. To many, if not all of you, none of this will be a surprise. I know you meet a lot of people and you spend a lot of time in people's mouths. But one risk, particularly if you're under time pressure, is the risk to only look at the mouth, to treat the mouth and to do a really fantastic job of it. But the real root causes of a person's poor oral health can often be left unaddressed. If poor oral health is a contributor or an indicator of other challenges in a person's life, then an opportunity exists, a significant opportunity, specifically about whether someone might have a lack of money, poor literacy, communication challenges, fear, cultural barriers, or some other obstacle. Whether any of those things is preventing someone from looking after their own oral health or accessing formal care. And I say this as someone who put off going to the dentist for 20 years after a bit of a traumatic appointment, so I have a bit of a self-confession to make there as well. When these barriers do exist and they are identified, referring people to appropriate support services or resources. And I have to say, I can already feel some of you raising your eyebrows in alarm and saying, we are not social workers, and that is true, you are not. As a former school teacher, I know it can be incredibly frustrating when people outside your profession decide that something else should become your responsibility. But at the same time, we all know that we can't look at issues in isolation. Nothing happens in a vacuum and nothing happens in a silo. We can't solve homelessness without talking about our justice system. We can't solve mental health without talking about our education system. And no, we can't make people happier and healthier unless we take a holistic view of their whole situation. As one dentist in a community health setting said to me recently, my duty of care simply can't end at the tonsils. This is obviously not a revolutionary approach. Already many professionals are called on to look out for signs of other issues not in their traditional signs of expertise, and I know that you are no different. Perhaps some of the best examples come from family violence. Devastatingly, 1 in 3 women will experience family violence in their lifetime. The Royal Commission into Family Violence was clear. Family violence can no longer stay in the shadows and it is everyone's business. But many women can't go to the police or to a crisis service. They might be scared, they might be ashamed, or their abuser might control when they're able to actually leave their house or who they can visit. The solution to this challenge has been to train and empower people who women still are able to contact and who can provide support to them. In this scenario, the woman might be able to drop their kids at school or at kinder, or visit the GP or the chemist, or visit the dentist. Suddenly, these interactions provide a significant opportunity for intervention. We know that head, face and neck injuries are all too common in family violence situations. Poor oral health can also be a sign if women are not allowed regular trips to the dentist. Dentists and other healthcare professionals have a vital role in identifying family violence and responding to disclosures. And I know that many of you have attended the sorts of training that, for example, Domestic Violence Victoria provide, and also advocate for family violence training in your own practices and your own organisations. Here's a short video from Northwestern Melbourne Primary Health Network to flesh this out a bit.
I did want to tell someone, but I just didn't know who to tell or what to say or how to bring it up.
The one thing I felt was a sense of relief that I'd actually broken the silence, that I had actually finally told somebody.
Women want to be asked about domestic violence. They're not going to be offended at all.
I usually ask them, is there anything else going on in your life that you'd like to tell me about? I open the door, I give them that opportunity to talk.
She asked me if perhaps something was going on, something emotional or in my personal life that might have been affecting my health.
Another question may be, every couple fights at times. When that happens in your home, what is it like for you?
They're much more likely to disclose if you ask directly.
It's safe to talk about it to me, and it's not coming out of this room. It's between you and me.
You may need to ask the patient whether she's feeling frightened, whether she's worried about her children, whether she fears for their safety as well.
When talking about safety, it might be important to ask, are your friends and family aware of what's going on?
The women I see are mostly safe to go home that day, so you don't have to do everything at that first visit.
We keep asking and we keep the door open and enable someone to speak to us, in the future about what's concerning them.
It is important too to have a whole practice approach so that a no violence policy is upheld by every member of the practice.
That may include having a poster on the wall, having resource information in a private place, having something written up on your website.
It made a huge difference and I suddenly felt less alone and less isolated.
It was like this massive weight was lifted off my shoulders, and one person in the whole world knew that this was my life.
Asking is the very first step. You can start the conversation.
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 Too often the focus of our health system is on treating symptoms and dealing with crisis rather than looking at the prevention end. And I know many of you are very passionate about this. I've been fortunate enough to spend time with you where you've been particularly passionate about what the impacts of COVID might be. It's not brain surgery or dental surgery to know that stopping people getting sick or being in pain before it happens is actually a much better approach. The dental system isn't alone in terms of where it sometimes gets pushed in terms of its focus on treatment and crisis. Many of you I know are deeply concerned about the impact of COVID. Being unable to treat patients for periods of time means that waiting lists have only continued to grow, and it'll be harder for people to access your services until they need acute care. The mental health system as a parallel rarely kicks into action until someone is significantly unwell. Families struggle to get help before their safety is at risk. We know that low-income people, refugees, people from non-English speaking backgrounds are all less likely to come to the dentist for preventative work. And this was the case prior to COVID, let alone the situation that we find ourselves in now. One community member recently told one of our VCOS member organisations, we don't have a lot of preventative treatment. We wait until the last minute, until we have tooth decay or something like that. And they really called for reinforcement around things like how to clean teeth and how to eat. And I know again that many of you are working really hard on that. People are often dealing, as I mentioned earlier, with so many other things in their lives that often take precedence. For example, when we look at people who are newly arrived to Australia, they're so busy dealing with things such as where are they going to live, how are they going to settle their kids into some form of education, all of the different things that someone's navigating and landing into literally into a new country. A visit to the dentist becomes a very low priority until they've got a toothache. So, how do we get low income and vulnerable people to the dentist? At VCOS, we work closely with community health services. Many of you who are our members, and I believe you are joining us today. You run fabulous organisations that are a unique blend of health and community services, and you are deeply, deeply connected to your communities. You know and you have the trust of many of the most vulnerable Victorians. Just for example, during when the public housing estates were locked down in Flemington and North Melbourne, people were scared, they were terrified, and they had no idea of what was going on. But about half of the residents who were living on the estate were existing clients of CoHealth, a Melbourne community health service. So CoHealth arranged for staff who were familiar to the residents to start calling people, and when they could, to start knocking on doors, to let people know what was happening, to ask what they needed and to work to minimise people's anxiety. Even before they were able to access the buildings, I know that people from CoHealth were walking around the grounds in really clearly branded CoHealth outfits, waving to people who are up in the towers and were not able to get out. It's such a powerful example of how existing relationships can help people in really difficult and really challenging situations. And I have to say that was one of the most challenging situations that I've ever seen. The North Richmond community health model is also focused on more than just treatment. It's about empowering and placing people at the centre of their care. While they're languishing on a waiting list, people often feel neglected or forgotten. North Richmond uses this time to engage people about oral care and hygiene. And I have to acknowledge in saying that I know others do the same. I've seen examples from Star Health and other community health organisations in particular that I know work really hard in terms of looking at that prevention focus. And community health organisations are a real one-stop shop, not only dental, but also mental health care, addiction services, refugee health, sexual and reproductive health, and community development programs. So if a dental patient mentions joint pain, a staff member can help them see a physiotherapist. If they have an especially complex need, they can work with clinicians to develop a complete care program. So my message today is simple, although I do concede that saying, of course, is always easier than the doing. Across government, across social services and in health, we simply can't look at issues in isolation. We can't see people as a collection of issues or a collection of body parts. When a client or a patient is treated, it is the whole patient that is treated. And this doesn't mean that we need to be experts in everything. Folly and failure clearly lies that way. But it must be everyone's business to know what to look for and where to refer people and how we can help them. So I guess that is the message that I leave you with today. It's around, I think, how we work together, how we forge partnerships, and how we best deliver for every Victorian and every Victorian community. I want to thank you for the vital role that you play in delivering the very best outcomes for every Victorian and every Victorian community, and helping people live lives that are happy, healthy, pain-free, and lives in which they're able to smile. Thank you for giving me the opportunity to speak today. I really appreciate it, and thank you for being so generous in your time and listening with me. Thank you.
Thank you, Emma. That was a fantastic talk. Thank you for your time this morning.
Thank you so much.
And thank you for knowing so much about our business.
Oh, my absolute pleasure. Thank you, and thanks for having me, Sue. Much appreciated.
Pleasure. Thank you. I think you will agree that conversation from Emma and the presentation that she has given us some food for thought. It is one of the things we've been working very hard on at DHSV around how we can do more prevention, how we can look at integrating care, not just oral health care, but care across the health system. So thank you, Emma, for those great words. If any of the videos that Emma played have raised any issues for you personally, please make sure that you reach out and contact Lifeline or Beyond Blue, or even just talk to somebody in the business. We're going to take a short break. We are running a little ahead of time, but we're going to take a short break, around about 10 minutes. So we will be back at time. We will be back at 10 past 10. So we will see you all back here at 10 past 10. Stay tuned. So welcome back, everyone. I hope you had a nice cup of tea. We're running a little bit early, so we're running about 20 minutes early. So I thought I would take this opportunity, particularly on the back of the conversation that Emma has just had with us around prevention, to actually give people a quick update on where we are in our value-based healthcare journey. I know that people have asked about this a lot, so While we've got 20 minutes to spare, I'm going to run through a slide deck that I actually worked through with our board last night in preparation for our new strategic plan. So bear with me and I'll quickly flick through these slides to just give people a bit of an update on where we are at with that. So what is value-based healthcare? So what is value? Value is the, I guess, how do we improve the outcomes of patients at the most appropriate cost? So it's about how we can actually measure value going forward. So looking at the outcomes that are important to patients particularly over the cost of delivering those outcomes. That's what the value equation is about, and that's what we're trying to achieve. So what are the principles of value-based healthcare? These are the principles that we've been working towards over the last probably 4 years now since we started this journey. So the principles look like this. We want to have person-centred care. We want to be able to co-design care with our patients, and we want to organise the care around the patient rather than the patient actually being the one that has to run all over town to get the care that they need. We want to be able to provide the right care in the right place by the right person at the right time. We have had lots of conversations about this in relation to how do we make sure that we're actually going to see patients rather than bringing them to us all of the time. How do we make sure our staff are working to the top of their licence and their practice? We want to be able to measure outcomes that are important to patients and the cost of delivering those outcomes. We want to reduce unwarranted variation. We know there is a lot of variation in the oral healthcare system, and the plan is to try and reduce that as much as possible. There will always be variation because we're dealing with people on a regular basis, but it's really about how to remove the unwarranted variation. We want to integrate care across the health system. It's a bit like what Emma was saying today. How do we make sure that if a patient is in front of us, we take all of the opportunities? We're not just looking at their mouth. The care doesn't stop at the tonsils. I thought that was a fantastic line. So how do we make sure we're actually looking at the person as a whole and actually sending them to the places that they need to go to if we find an issue? And how do we achieve the best outcomes at the most appropriate cost? So why do we want to do this? From the system perspective, we know that we've got an ageing population, we know that we've got increasing costs, we know that we've got increases in chronic disease. We also know that we've got rising consumer demand. Dr. Google has helped that along the way quite substantially. Why, if you're a provider, do you want to change? Well, the providers, so our clinicians that we spoke to over time have said, we are doing the same thing on the same person and they're not getting better. People are coming back with the same, another broken tooth or another tooth that needs to be removed or filled. They're saying to us that they want to make a difference in people's healthcare and they want to actually see their healthcare improve. And from the patient's point of view, you'll see that we use consumer, we use patient, we use client. We're still having a conversation around what language you should be using, but it doesn't really matter. It's the person in front of us at the time. So they actually want to enjoy a life without poor health. They want to know and understand what they need to do to improve their oral health. They want to be part of the decision making. They don't want to be told what to do. They want to actually be part of that so that they actually understand what it is that they can do to improve their oral health. So what would the new world look like if we were actually be able to achieve all of these things? We would be able to measure outcomes and we would understand the drivers of those outcomes. We would have a system that is enabled, not hindered by technology. We would spend time and resources on prevention and early intervention. Consumers' expectations would be managed and met, and unwanted variation would be controlled. And we would have a funding model that actually supports this rather than a funding model that just supports outputs. We would go from a siloed system into an integrated system, so our care teams would be working as teams. We would be able to measure and monitor outcomes, so we would know that we're making a difference. And the systems and supports networks that we need would be there when we need them. From the patient's perspective, we would take them from being waiting and worried. As Emma pointed out, people are on wait lists and they're sitting there waiting for a long time, but how do we make sure that they know what to do? How do we make sure we've got those prevention messages? They're actually improving their oral health while they're waiting to be seen in a chair. So this is our current state to our future state. We would like to be working as a real team, coordinated and integrating care, focus on prevention and early intervention, focus on shared decision making. We would be funding for outcomes rather than throughputs, and we'd be thinking about health outcomes that are important to patients. We would be using risk management tools rather than actually trying demand management tools, and our unwarranted variation would be removed. So how are we going about this? So on our journey, we started in 2012 with the first public oral health model of care, which was developed by the previous CEO and the clinical team at the time. That's been transitioned into what we now call our DHSV value-based healthcare framework, and looking at how that framework can be implemented across the organisation. We looked at Porter and Lee's model. So Michael Porter from the Harvard Business School developed a model in relation to value-based healthcare. It's a very economically based model, and it talks about measuring outcomes, it talks about funding, it talks about ICT, but it doesn't really talk about culture, it doesn't talk about capability, it doesn't really talk about people. So DHSV has developed their own framework to implement value-based healthcare, and it looks like this. It has 9 core elements, and it has consumer and workforce engagement at the centre of everything that we do. So I'll quickly take you through where we're at on all of those pieces of what we call affectionately the wheel of cheese. So in the centre, we have consumer and workforce engagement and co-design. So what have we achieved in that space? From a consumer perspective, we spent a lot of time talking to our consumers. We went out to the most vulnerable in our population, people without homes, to people in refugees. We went out to the Aboriginal and Torres Strait Islander communities, and we asked them what are the barriers to attending an oral health program, what are the barriers to actually not going to see an oral health clinician. We also asked them what it is that they wanted from the system. So some of the information I shared with you earlier about how it would be improved for a consumer is the information we received from them. We've developed a very strong community advisory council that help us in a lot of ways to co-design what it is that we do. And you can see the list of things that we've had them working on with us over the last couple of years. We have a community advisory network as well, which is much broader than the advisory council, and they actually support us in all of the co-design activities. We have representation of consumers on our board subcommittees, and we actually have recently developed a school dental patient, a parent advisor group, and we have over 60 parents enrolled in that for us. So where are we going next? We want to increase consumer participation in what we do. We want to look at how we could actually have consumers in our recruitment and selection processes. They'll be very much a part of our new strategic planning development. We're in the process of looking at a master plan for the Royal Dental Hospital of Melbourne. They'll be very much involved in actually how do we make sure our patient flow and the design of our organisation works for them. What have we achieved from a workforce engagement point of view? Again, we spend a lot of time value stream mapping and having conversations with our staff about what it is that's great about the dental health system, but what is it that is not so great, and what can we actually do to improve that. We've done a lot of work in co-design with our staff around all the different models that we've been developing. We want to continue that piece of work, obviously continuing to co-design and continuing engagement in our engagement processes. And that's not just about the staff that work at Dental Health Services Victoria, that's about the staff that actually work across the state in public oral health. So in relation to the models of care, which is the blue up in your right-hand corner, and they're both individual models of care, but also prevention and population health models of care. So we've done a lot of work. We've actually done a couple of proofs of concept to test some of the models that we've implemented. We've implemented new measuring tools to enable us to measure outcomes and also to measure experience for our patients. And we've developed some really cool telehealth capability. There's a lot more work to do in this space, some more models for us to look at around teaching clinic, around specialist services. How do we actually better improve our prevention and early health intervention models? The next piece is around culture and capability. As I said, Michael Porter's work was very much around an economic model. We wanted to understand how we actually needed to improve our organisation to be able to go through this quite transformational change. So we developed a respectful workplace framework. We've developed a change management framework. We spent a lot of time, Public Oral Health Innovation Conference, all of those things that actually help us engage and improve the capability of our organisation. We want to continue that process, and we will continue working on how we can engage with our staff, how we can develop them, how we can continue to improve people's leadership capability. The next piece of the wheel of cheese is about measuring outcomes and costs. We actually have published with the International Consortium of Health Outcome Measures an adult oral health standard set. So this is a standard set of questions that enables us to measure patient-reported outcomes. We've been working with ICHOM over the last 3 years to develop that set, and it's recently been published. We're now working with some of our counterparts in the UK and also in Brazil to look at how we can actually validate that set and make it a smaller set. It's currently a very long set of questions, a bit repetitious, so we're working to actually improve that. We've also implemented or actually looked at a time-driven activity-based funding model or costing model so we can understand where all the costs in our organisation are. We want to continue that piece of work, and at the end of the day we'd like to be able to triangulate clinical outcomes, patient-reported outcomes and the costs so we can actually define what value is. The next piece of cheese is about a funding model. We've spent quite a bit of time talking and developing a new funding model which would incentivise outcomes rather than outputs. We were planning on actually shadowing that last financial year, but obviously COVID got in the way and we were a bit distracted doing other things. So we will bring that back to life and actually start having those conversations again with the Department of Health. We've also implemented some new item codes and prices to actually incentivise prevention and early intervention and disincentivise low value care. We want to continue down that pathway. And for all of those people who are out working in our community dental agencies, we've been collaborating with the Department of Health on how we can actually get a consistent DWAR price across the state. So there is a lot more work for us to do in that space. We will also continue to lobby the federal government around how we can get a Medicare style payment program for oral health. So we actually end up with funding to improve the oral health of all of Australians. The next piece of the puzzle is about data collection and evaluation. We've done quite a bit of evaluation. Data collection is one of those things that actually takes quite a bit of energy and effort, and we're trying to improve the way we collect data. We have a lot of data in our system, and how can we actually integrate that data across the system? How do we use the data to better improve the systems that we're actually working on? So it's one of those things, if you don't measure it, you can't manage it. So how do we make sure we're actually measuring the right things and being able to provide the data to people who need it? The next piece of the puzzle is about integrating care across the systems. This is one of the things that Emma was very strongly talking about in relation to some of the community dental agencies or the community health agencies that actually have that capability. How do you actually make sure that if a patient comes to you and they have a domestic violence issue or they have a pain in their knee and need to see a physio, how do we make sure we are integrating the systems, so making sure that dentists aren't just looking at the oral cavity? We have been working with a number of agencies. We're also working with the maternal and child health nurses in our Smiles for Miles and our Healthy Family for Healthy Smiles program. And we also work with other health agencies around complex surgery. We do want to bring the mouth back into the body or take the mouth back to the body. Either way, it doesn't matter. We just really need to improve the way we integrate our systems across Victoria. The next piece of the puzzle is about ICT platforms. For those of you who've been working in the Royal Dental Hospital of Melbourne or in DHSV more broadly, you will have seen quite a substantial change in our IT platforms over the last 12 months. We've been implementing digital radiology, chairside computer upgrades. We're actually in the process, we're about to kick off the project to implement the new electronic oral health record across the state. We would like that to be able to have interactive portals for patients, so patients can actually interact with our system and understand where they are in their oral health care journey. So a lot of work has been done in that space, and we're looking forward to actually continuing that piece of work because it does make our lives easier. Sometimes not so easy. Infrastructure. So the other important piece about this is how do we make sure that the infrastructure that we have supports our patient's journey? So how are we making sure that our flow through our systems works really well? How do we make sure that the patient waiting areas are actually comfortable and nice? We've done a lot of work with the school dental program, making sure the vans are equipped appropriately, making sure that that infrastructure is fit for purpose. So a lot of work has gone into actually making sure that our infrastructure is at the best that it possibly can be. There's a large piece of work going on at the Royal Dental Hospital of Melbourne at the moment in relation to improving some of the infrastructure that we have there. We've actually gained a lot of recognition and shared a lot of our journey with people across the last 3 years. So we've we have two case studies with the Value Institute for Health and Care at Dell Medical School in Texas. They used 2 case studies about us in their training programs about value-based healthcare, which is a fantastic recognition of the work that we do. We've achieved multiple awards across the years from the International Hospital Federation, from the Integrated Care Federation. We actually, as Minister Foley spoke about in his presentation, we got a recognition from the International Hospital Federation around our work on COVID-19. We are shortlisted for a Value-Based Healthcare Award for the Smile Squad program, which will be in the conference in Perth in May this year. And we reached the formal application stage for the Value-Based Healthcare Prize in Europe this year. We weren't shortlisted, but we got to the final stages of that, which is fantastic. We've also done multiple presentations across the state and around the world in relation to the work that we've been doing in value-based healthcare. And we've also written multiple publications around our work in value-based healthcare as well. So that's the end of the presentation. I hope I've made up the 20 minutes that was needed to be made up, but I hope that it's given you a bit of an understanding of not only where we've been in value-based healthcare, why we're actually looking at it, why we're looking at those principles. I think it's really important for people to understand that value-based healthcare is not a thing, it's a set of principles by which we're actually looking at how we can improve the oral health of the Victorian community. So thanks for listening to me. I'm now going to introduce Suzi Finkelstein. It gives me great pleasure to introduce Suzi today. Suzi's the CEO of Women and Leadership Australia. Suzi has held various senior leadership roles with the Australian School of Applied Management over the past 10 years, most recently as the Global Executive Director of its Women and Leadership entity, which works to increase gender equity through delivery of professional development in Australia and New Zealand. Having been instrumental in the strategic growth of Women Leadership Australia, Women in Leadership New Zealand and Women in Leadership internationally, Suzi has built a powerful reputation for developing leaders and has become an influential role model. Suzi's here today to deliver a workshop on developing your leadership skills. This is an interactive workshop, so I encourage you all to actively participate. So welcome, Suzi.
Thank you so much, Sue. And I think I can trump you, Sue, because I stepped into this role, would you believe, in April 2020. So I sort of knew what was going on. So when you think about what leadership is, it actually helps to think about the context as well. I'm delighted to be with you all today, and interactive workshop, which is, who would have thought this time last year, an interactive workshop that we'd be able to achieve what we can in this style, that I can connect with you wherever you are. And this session is actually created to give you a pause, to have a think about where you're at and what does leadership actually mean. Sue spoke this morning about leadership in terms of it's a practice. And we heard from Dr. Zoe Weiner as well, because we know that leadership really matters. So in this session, I'm going to be sharing with you why I think leadership is so important for everybody, because regardless of whether you think you are a leader or you think you aren't a leader, you're actually standing in those shoes and making an impact. So this session is actually designed to give you awareness of the impact of the space, of the steps that you're taking and what they actually look like. Interactive, and that's what we're going to be asking from you today. So there's going to be opportunities for you to become part of a word cloud. So there's going to be a few times that I'm going to ask you to think of a word, and it's going to pop up for you on the app. And all we need you to do is to send it through, and then we'll be able to see it as part of the slides. And there's also going to be polls as well. But if you don't have something to write with, I encourage you to grab something now, because I'm going to be asking you some questions throughout this session as well to actually think about what this looks like. So, leadership, what is it? And I think everybody has a leadership story. And it's now your opportunity perhaps to think back of when was that time that you thought, okay, was this actually stepping out of what I normally do? And could we define this as leadership? So in today's session, you'll hear a little bit about me, but this little vignette about leadership, I think it's one that you probably could all relate to. So as Sue explained in my bio, my background's education, and I've been working across sectors. But particularly I started in schools and then worked my way up into adult education and moved from there. And what I found, it was very much about education for all. I would be going in and out of organisations and communities, and it was about leadership. I've always been passionate about leadership, but what was really interesting is that I started noticing that leadership wasn't available for everybody. So equity, diversity and inclusion, the big buzzwords that we keep hearing about, they became the stance that I was taking moving forward. And I worked throughout different sectors, disability, socioeconomic challenges, but I kept finding gender was a challenge, and women are half the community, yet we weren't seeing them represented in organisations and definitely in teams. So that became my focus, and I was developing lots of different forms of leadership courses and going in and out of organisations. And then finally, I was ready to actually start working with an organisation rather than as a consultant. And I had one of those moments where I was offered a wonderful position working in an organisation where I'm standing now, in Women in Leadership Australia, and bringing me in because of the challenges around development and opportunities for women. But what I found we were actually teaching is that we were teaching women how to sound like men. We were teaching women how to drop their voice. We were teaching women how to stop apologising. We were teaching women how to look and sound like everybody else around them. And there may be some of you right now thinking of a time where you've needed to blend in. But I realised if we were talking about leadership, that we can't have the cookie cutter mould. We actually have to define what leadership is for ourselves. So after 2 weeks in the role, I spoke to my manager and I said, you know what, I don't think this is the right fit, because I can't stand up in front of groups at conferences, in workshops, to teach women how to become like everybody else sitting around them. And he had a little smile on his face and a smirk, and I thought, uh-oh, here we go. He's going to walk me out. He knew it was coming, and all the imposter syndrome words came up. Who are you thinking that you could be doing this, Susie? Why are you the one standing up here? Who's going to even listen to your opinion? And what actually happened at that point, he said, Susie, that's why we've invited you here. We really needed to hear your view, and we needed to start shifting the way we focus. And at that point, I realised that those times when you think about should I or shouldn't I, that's the time we need to really listen. So the first opportunity for you to have a think about leadership, but also to share us some words, in a moment you're going to be sent a link. And when I talk about leadership, I would like you to think about what word stands out for you. And as this word cloud comes to you, we will soon see what words come up. How do you describe leadership? And soon you'll have that available to you now, and you can start thinking what word, type it in, send it through so that we can see. This leadership word might be one that you see in others. It might be one that you aspire to. It might be one that holds you. And so the word cloud will be formulated now. And I think just as you're thinking about these words, I can quote Sue from this morning. I told you, Sue, that I'd be drawing on everything you said. Sue talked about empathy, and we saw that great distinction between empathy and sympathy. So when you think about the words for leadership and somebody sitting next to you and you think, yep, they've just demonstrated leadership, what was it that stood for them? And what did that actually look like? And I believe the word cloud will be coming through. It's nearly there. Moving. So encouraging you to think about what are the words when you see leadership. We know that leadership isn't something that we all become at one point an expert in. It's something that we need to practice. We need to ensure that on the day-to-day that there are mistakes that are made. It's not a perfect practice, as Sue spoke about this morning. It's something that we need to continue to reflect on as well. And the word cloud coming through, or should I move on? Move on, okay. So jot down those words for yourself and think about what are the words that actually mean, because in a moment I'm going to share some definitions with you as well. This is my favourite leadership book. It's the Bible that I put next to my bed. And you may have heard from this great person, Ronald Heifetz, and he's worked with a team, adaptive leadership, because we know that leadership is something that we continually have to adapt. And what I love about working with him is that he is a wordsmith. And some of the words that I'll be quoting today as well will be about that. So he spoke about leadership is not a practice, it's a practice, not a theory. It's the practice of mobilising people to tackle tough challenges and thrive. But I've got two words down there, management and leadership. And we heard this morning as well about what the difference is. And I think in many times we can actually identify what management looks like, but sometimes we hide it underneath the word leadership. So for management, it could be about the times when you've really needed to use that process-driven practice that you have. It could be about ordering supplies. It could be making sure that everything around you is working, because we know that all of you today have technical expertise. And when we think about management and leadership, they are actually words that sit above that technical component of what you do. So if we were to describe management, it's about simplifying complexity. It's about getting things done. And then if we think about leadership, it's about holding some of that complexive state. It's about the challenges and sometimes the changes that we have no control. And I think in 2020, when we look around and what we see, leadership stood out. And then there were times where we thought leadership should have stood out. So we're actually identifying that this is a time that we can actually move forward with this. And can we have a word cloud here, or we keep going? Keep going, okay. So if we start looking at what that actually looks like in terms of this state. So management could be the doing. And on the other side, jot down, what do you think would be the word when leadership shows up? So the focus on management will be about the task. The focus for leadership will be about people. And we've heard about that a lot today. The focus on actually understanding and knowing our people. As I said before, the management focus would be about creating a procedure, whereas for leadership, it's actually looking at the why we do it, how we do it. It's understanding that process, and sometimes challenging. And just give a little tick next to any of these words that you think, yep, that's something that I may have done over the last week or month. Think about over the last year, how you stood in that space. Management is very much about now getting things done, whereas leadership is when we have to start gazing into the future, and it's starting to look at what that vision really needs to be in the future. For management, there is that direction. It is very direct, it's here and now. And it's do this is what we need. We have a timeline and we need to measure that. Whereas leadership, it's actually thinking about how do I get people on board rather than telling them. And how many times do you use the words, the questions that enable people to step in? And how many times is it just the direction and telling? And then we have the targets. We have to measure this, as we know that what gets measured gets done. So management is very much about that, whereas leadership, it can be a little bit nebulous sometimes, and that's why people say, I'm not really quite sure how to engage in this space. The status quo and quality improvement, I think it's one that everybody today can really relate to. Sometimes we do need the status quo, but leadership is actually about looking at what's the add-on, what can we be doing better, and what does that actually look like. And finally, management is very much about creating certainty. We want to ensure that we are able to walk beside our teams, walk with our clients, with our patients, to create certainty. But is there a time when we actually have to stand by the fact that it is uncertain and what these times actually look like? So within this, have a think about for yourselves, what does certainty and uncertainty look like for you? What does status quo and where is the quality improvement? Who is it in your team that stands up and actually does that? And what does that look like as well? And then if we look at management and leadership in terms of these pillars, the first one we think about is around that direction which I spoke of. So if management is providing that, then leadership is framing the key questions. And I think questions is something that we have worked out is probably the most important tool for a leader, because you can lead with a question. Have a think about the times when you've been asked a question that shifted your thinking, when you've been asked a question that has enabled you to really lean in and to think about things in a different way, or realising that the answer's really about what you need to do, and rather than where you were going before. Now, this idea of protection is important. We need to shield the people around us. We need to be really aware of what it looks like to ensure security and safety. But for leadership, at times we need to have this pressure felt. And it'll be interesting to think about for yourselves, when has there been time when you've felt that pressure, but it's actually led you to a really good outcome? Sometimes we think as leaders that we actually need to shield everybody from that uncertainty, from that discomfort. But critical to today's conference around innovation, around leadership, sometimes that pressure is where we actually enable people to stand up, to start thinking differently. Controlling the conflict. Recently, I worked with a leader and she was very impressed. She was CEO and she said, you know what, Susie, I don't think we need to have any team development because we don't have any conflict. And our team started working with her team one-on-one, starting asking questions, coaching. And what we found is that they didn't know how to bring up conflict because they were continually being managed to restore that order. Now, conflict can be really healthy. Conflict can enable us to ask questions that we didn't even realise were important. Conflict enables us to actually listen to what is most important. And sometimes we tell the story for ourselves of what that looks like. So as a leader, we need to expose and let emerge. I worked with an organisation recently and they actually had a target for their people leaders that they needed to show a difficult conversation once a fortnight. Now that's a lot. Once a fortnight to have the conversation that really mattered. The conversations that usually we sort of navigated around. Now, why did they do that? Because they realised that there was so much conflict that wasn't able to surface and they weren't able to move through it. So have a think about how do you engage with conflict? When has it been helpful? Sometimes we talk about having a miner for conflict. So that's actually somebody that enables a space so that we can have those conversations. So being able to, whether we have a miner, a mediator, somebody that can actually hold the space so that conflict is reasonable and also respectful as well. But when we can learn these skills and think about not just at work, have a think about your environments. How does conflict play out? How do you manage conflict? Or do you let it emerge? and engage with it as well. And that speaks to the next one as well, which is about shaping norms. So the next one is about maintaining norms. So as a manager, we maintain the norm, whereas as a leader, we need to start challenging norms. Now, this is a really important point in terms of inclusivity, in terms of culture. So we hear about this idea that when we recruit, we're looking for a culture fit. Yes, that person will really fit in. Whereas what we need is to add to our culture. And when we recruit, the person that comes in within the first 90 days is able to give us a really good sense check about what our norms are. In some university studies I was part of, we needed to do some culture audits in organisations and in different practices. And what we would do is we'd collect artefacts. And what artefacts were is actually going in and watching, having a look at how people engage. What's the email communication like? How do people talk to each other? And what does that actually look like? These were the artefacts, and we were able to then do a culture audit to understand what was most important and what the norms were, and were the norms actually enabling people to be their best? And often that wasn't the case. So sometimes we need to have that ability to stand back and look in, and at other times we need to have the ability to listen when others say, this is what I'm noticing. And Sue used that word this morning, which I love, curious. We need to be curious about our norms. Usually a norm and a definition about culture is that's the way we do things around here. When somebody asks, why is it? Well, that's the way we've always done things. Is that actually enabling us to all be our best? Is it enabling us to be the best, to deliver the best work that we have? And then finally, orientation. And this is an interesting one around management. So it's about clarifying responsibility. So orientation is about, when we need this, it's really important that we do have that clarity. We're able to understand exactly who we're accountable to, what we're accountable for. Whereas sometimes as a leader, we need to create a disorientation. So sometimes we need to challenge the clarification, and that can be really tricky and also take a lot of courage. Now, as we go through this list, I hope you are getting a sense that both are really important, management and leadership. So if we have one versus the other, that's not going to work. Sometimes in our roles, we only have the opportunity to manage. And in a moment, I'm going to ask you to consider what that actually looks like for you. So if we have three components of your role, we've got your technical expertise, and that's when you're in that space and doing what you are as a subject matter expert in terms of your delivery. But then it's everything around that, and particularly around the questions, the decisions that are made. What does that look like in terms of management and leadership? And we're going to have a live poll that I'm hoping will come onto your screen. And this is going to, in a moment, it's going to come up to ask you to think about your percentage of time that you spend leading. So if I had a video camera following you around, what percentage of your time would you spend on leading? And this poll is going to come to you now. It's coming, that's good. It's in the ethers, flying through. And we just ask you to have a think about, just click on the percentage of your time. What percentage of your time do you spend on leadership? What does that look like? And if we were to go back while it's coming to you and thinking about all of these different components, thinking about leading, thinking about the challenging the norms, lead exposure being felt, the uncertainty, the quality improvement, creating a vision, engaging, having a future focus, process and people. How much of your working day do you get to spend on asking those big questions, on letting the pressure being felt, challenging norms, enabling conflict, and perhaps even challenging the orientation? And the poll should be coming back by now. Yes. Oh, there we go. All right. So what have we got here? And they're emerging. As you're sending them in, we can see the percentage of time that's being spent in this leadership space. Okay. Have a look and see those results and see if you can see any patterns for yourself as well. And the next question I'm going to ask you via poll is, what would you think is your ideal? So the first question is actual and the second one is aspirational. So the second poll that we've launched is actually asking you about what would be your ideal. If you think about how much time you're spending on your leadership, if we had that video camera, now in order for you to create the impact, in order for you to feel like you are stepping into this leadership space that is accessible to each and every one of us to make a difference, for quality improvement, what would that actually look like for you? And the polls are coming to you now. And they're coming back to us as well. Are we seeing any polls coming through? Yes, great. And as you're considering this as well, thinking about what is getting in the way. So if you think about your ideal and you think about your actual, what would it take for you to get you there as well? And often what comes up with this is that we start looking at what's keeping us busy. And I encourage you to ask this question of others. So here we have a poll coming through and the difference between what is the first poll that we had, and have a look at what these results are telling you for this poll in terms of how much percentage and what's actually required. So we run these polls and we ask these questions for many organisations and people, and we start looking at what does that actually mean. And if you think about, you can see the hearts at the top of the screen, they are very much about what is aspirational. And the crosses, which just happen to be at the bottom of the screen, is all about the actual. And I think what's really interesting is to think about what gets in the way from being in the aspirational. What keeps us in that 90%, 80% space of doing the management tasks? How can we flip that over? And I think that the sweet spot for many would be around the 20% management, 80%, or 30% management, 70%. And what would that actually look like for yourself as well? So for you to step into more of that leadership space, what could you be doing? What are the conversations that you need to be having? Firstly with yourself, but then also with others as well. Because I think this takes us to this concept of what leadership looks like. And I think during 2020, we all experienced many different forms of leadership. And Jacinda Ardern, I think, you know, in so much of the polls that we heard globally, her leadership really stood out because for once we were starting to see that kindness and strength can work together. And you don't have to apologise for kindness because actually it can provide and bring strength. And this quote as well, which I think stands out in terms of what a strong leadership looks like. We want to change perceptions of what strong leadership is. We learnt with COVID is that actually a different kind of leader can be very beneficial. Perhaps people will learn to recognise and value being risk-averse, caring and thoughtful leaders. And I'm sure many of you watched as she sat in her bed and did Facebook Live conversations when she was scared and concerned for her people, for her community as part of COVID. It wasn't scripted. She was showing vulnerability like we've never seen before from a leader. And this is really important as well. We need to start looking at how can we show up and be real. And how can we create vulnerability so that it actually holds us up rather than knocks us down? And Dr. Bonnie Henry, many of you would have come across her, I'm sure. So she is the Provincial Health Officer. She's a Canadian physician. She's basically equivalent to our Brett Sutton. And her communities heard from her daily. And she was just about to do a briefing about this time last year, and she scribbled 3 words down on a piece of paper. Being thrown into this space, into crisis management, she was familiar. She'd worked in the Navy as a physician. She specialised in trauma, and she understood when crisis happens that there's a lot of anger and there's a lot of fear. And the 3 words she wrote down were kindness, calm and safe. They were the words that ended up being the main focus of a book she ended up publishing and writing last year alongside her sister as well. Those 3 words she felt impacted everything, and she would always remind herself on any briefing, on any decision that she needed to make, that she would hold those words, kind, calm and safe. And if she could actually bring those 3 pillars together, she knew that she was being the leader that was so impactful and the one that she was aspiring to be. And I think Ira Hisloot as well has taught us a lot. So he's from the Netherlands, he's a professor and he specialises in crisis management. And this builds on from Jacinda Ardern with a slightly different focus. People want leaders to project compassion and an understanding of how the situation is for those concerned, and to also project the hope that together we can manage the crisis, even though we don't know everything about this present situation. Now, this was a whole different focus for leadership, because so many of us subscribed to the textbooks, subscribed to the view that everybody wants the person in front of the room to have all the answers, which means that there really is only one leader. But what we've learned last year is that when we can actually say we don't know all the answers, we can actually step into a different space. And this is really important to consider as well, what that actually looks like. How can you sit and stand and be with people when you don't have all the answers? We had a conference during the year and we had one of the Ministers for Education speaking. And what she said is that she's encouraging all the directorates, all the principals, to actually stand with their communities and say, we don't know. We don't have the script. We've never been through this before. But to regularly communicate what they did know and what that looks like. And we know that when we can actually say, this is what we don't know, but this is what we're doing about it, this is what we don't know, but this is what we do know, that people do feel safer. So we used to always say that the leader was the bus driver getting on the bus, and everybody wants to know the bus driver knows the best route, the best way of getting from A to B. But we now know that the bus driver sitting in a leadership position needs to actually pause and consider, do we need to change the route? Is there something about this route that we don't know? And what does that actually look like as well? I was part of a panel of Ernst & Young last year, and they brought together CEOs across many organisations. And I sat in an interview just right after Alan Joyce from Qantas. And the reason why they were bringing us together, and my leadership and Terrain and his very different, is that they knew that they needed to create some live research. They needed to collate data of what CEOs were doing in the here and now, because so many had no idea of how to lead through this crisis. And what they did is they did one-on-one interviews, and they brought us together, and then we had some discussions about what were the most critical issues. And what they encouraged us to do, they called it a future back focus, to actually look beyond pandemic, beyond new normal, because we know that that's what we're learning about now, into that next phase, and to plan for that, and to strategise. And even, like I asked you to think about percentage of your time and management and leadership, they're asking for people in these roles to actually have a percentage of their time where they're beyond the crisis, beyond the new normal, which is very hard when all we were doing last year is really understanding what each day was presenting to us. And so the challenges then were really very much about what that looks like. How do you take yourself into a space where you don't know? How do you strategise when you don't have the playbook to follow? And what does that actually look like? And I encourage you all to have a think about the learnings from you. Every one of us went through this crisis. If you were to go back with what you know now, how would that be different? What would you have done differently? And how much recognition can you give yourself for doing what you did, and to hold that space and manage what you're doing? And Mary Massaglio, also, who works in the digital futures, spoke a lot about this importance about people. So as she says, it's a humanitarian tragedy that continues to disrupt millions of lives. And we know that good leadership is critical. There's perhaps one silver lining, which is that the crisis represents an opportunity for leaders to create more team cohesion and innovation in the face of adversity. So if we think about people, we suddenly saw, as I said earlier on, a leader focuses on people, a manager focuses on task. This crisis enabled us to understand the importance of people first. And McKinsey said, and I think so many people have quoted this piece of research that was done early in the crisis, there's nothing like a crisis that clarifies what's most important. And what we learnt is that what most is important, and we've heard through today, it is about people. And what can we do to ensure that we know our people and we really understand what they need? Which takes me to the next part of this workshop today. It's actually looking at the cornerstone of everything we stand for. And many of you would have come across the great work from Bill George. And he's talked about, and he's lectured and taught and written about this idea of a true north, of understanding what is calling you, what's most important to you. And that's how we define values. As Dave Ulrich says, values inform desired results when leaders ask the question, what is the right thing to do in this case? And when they find a clear answer to this question, leaders produce lasting results. So when we have a think about what is most important to you, we need to identify what your values are. Now, this values exercise that I'm going to walk you through now is one that I encourage you to do regularly, because one thing that we've learned, values are not something that's just sit on the website, sit on the plaque on the wall. Perhaps even we wear them around on our lanyard. Values need to be real. They need to be close to us. And when we think about our personal values, they will change over time. And there's all different ways of segmenting values as well. Sometimes they're the values that are expected, they're thrust upon us. Times that there's pressure to stand by these values. And other time these values are actually what is most important to you here and now. So, first question for you. On the next slide, and I'm going to give you a couple of minutes for this, there's a slide with values on it. Now, I've got slides with 200 values, and I thought that might be a little bit overwhelming. So we've pulled out the values that are frequently used. Sometimes people tell me that, you know what, Susie, I prefer not to look at the slide, not to look at the list and come up with my own ideas, which is great because there's definitely no right or wrong. People say, is that a value? If it's important to you, it's a value. And sometimes the list can actually prompt more thinking. So the word might not be on the list, but then you can actually think about the word next to it in my thinking is the word I want to land on. So the first part is actually thinking about the list. Then what I'd like you to do is write down on a piece of paper your top 5 values. And then I'll bring you back to this slide. So this is the list. Identify words that stand out to you. You might find that some words actually mean the same thing to you. Some words connect with other words. So just as a top, write down top 5 values from this list. And how do you define a value? It might be, the value might sit up for you very clearly when you're in an impassioned conversation at a dinner party and you realise that this is something that stands very close to your heart. It might be when you get very upset around what others' behaviour is around you and you just don't understand how they made that decision. It could be the value sitting underneath that. It could be one that has been ingrained in you for so long. Perseverance, it's something that you were taught over the years. It could be something that you've identified recently about connection and why that is so important. It could be one that in the great work from positive psychology around gratitude and hope. In a moment I'm going to ask you what these values look like. But don't worry about that now. Just have a think, 5 top values. And then what I'd like you to do is to cross out one. To have a look at your list and think, okay, if I crossed out that value, the other 4 values will still enable me to stay in my direction. And you know what's coming. I'm going to ask you to do it again. And again. And again until you have one. Now this is a great exercise to do with your team. And I encourage you to do it with sticky notes. And if you're brave enough, ask people to stand up and they have their 5 sticky notes on their desk, on their table, and ask them to put one down and then another until you get the final one. And they may glare at you as if you can't ask me to take that away. But usually we find there's one value that stands out. It's like an umbrella term that seems to be most important for you now. And in a moment, we're going to see if we can have the cloud coming back. Yeah, it's going to work. That's good. And we'll be able to see what value stands out as your one value. So, if you think about the values that are most important, we're going to have a look at your actions in a moment. And Stephen Covey, I'm sure many of you are familiar with him. We judge ourselves by our intentions and others judge us by our behaviour. But before we go to the action, what I'd like for you to think about is your one word. What's your one value? Because we're going to use this idea that if you all had a t-shirt, this one value would be what you say is most important to you. And in a moment, we're going to look at what's the back of your t-shirt, what you do. But before we go there, if we could have those, so it's gone out and there we go, we've got some words. Front of your leadership t-shirt, we've got some words: empathy, respect, trust. Keep sending in your words. There we go. And you can see as they become voted again, they become bigger. So the words that have come in now, we've got integrity, that's standing out. Honesty. Respect is still the big one. And I love respect because we can challenge what that looks like. We've got connection that's standing by. Honesty, trust. Resilience is also there. Kindness is starting to stand out as well. Integrity is still the one that's standing. So we've got servant leadership, leading by example. And I'm glad you're choosing to do two words, not just one, if it suits you. We've got teamwork in there as well. Professionalism. Professionalism is actually becoming bigger with that as well. But integrity is the one that stands out, which I think says a lot about the work that you all do. So we've got empathy. What's another word that's coming up? Curiosity. There we go, Sue. Your word's coming in there as well. Humility, an interesting word that's coming through. Hope is also showing its face. Resilience is becoming larger. And teamwork's also getting more of those. Connection, respect, and kindness. Fairness has also shown itself. Sincerity, gratitude. All right, we're probably nearly, yeah. Okay, and can we just, go back just so I could see, or is it too late? No? Sorry, that's where we landed. Okay, so the one word that we're seeing, the biggest word there is integrity. We've got respect, kindness, empathy. Now your word may not even be in there, or you may have decided to keep that to yourself. But what I'd like you to now think about for these words that are on there now, thank you, if you were to be given a video camera and the word integrity was on the front of the t-shirt, if you had that video camera, what would you be seeing to show what integrity actually looks like? Because front of t-shirt, and now I'll go to the slide, is what you say is important. But your back of t-shirt is what we see you doing. Now, it's not to mean that you're lying on purpose or you're doing anything disingenuous, but the reality is that life gets in the way. And I was doing some work not so long ago with the Navy, and they had respect on the front of their t-shirt. And it was very interesting when they started looking at what does respect mean? Because everybody they asked had a different definition. And then they started working out, what can we do about this to make these front of t-shirts align with the back of t-shirts? That we need to start making the behaviours visible. And we need to start measuring as well. If we say we're doing this, how do we hold ourselves to ensure that we're also doing that? So, an example. On the front of my t-shirt, it could be about creativity, innovation, risk-taking. And what do you think could be on the back of the t-shirt? Yes, we don't like mistakes around here. I don't want anyone to know that I've made a mistake. Well, hang on, how can I be a risk-taker? How can I be innovative? How can I value creativity if I'm too scared to make a mistake? Or if everybody around me won't let me make the mistake? On the front of my t-shirt, I had, when I was doing this a while ago, family. It was really important to me, young family, and this is why I worked. I did a lot of community work, and family was something that I felt was my true north. But after doing this activity and also getting feedback from others, do you know what was on the back of my t-shirt? Yeah, I can even hear it. Susie's not actually around that much with her family. When she's at home, she's doing emails and doing extra work. And when she's in the office, well, she's always the last one in the office. And she's actually not. How many school concerts were missed? How many times where I was dropping off the kids to do A, B and C? And that is fine, but I actually wasn't actually owning up to what that meant. And it took me a while to realise that a front of t-shirt value for me actually needed to be achievement. Because achievement was so important to me. And then what I needed to do is work out how I managed what else was important to me, around me, my family, to ensure that both of them could sit side by side. And that took a while to get there. But sometimes we have to be really aware. When our back of t-shirt is not supporting our front of t-shirt, there's something not aligned, or there's something in the way. So when we asked you to think about your front of t-shirt, we had those big words. And I'd love you now to think about what would be on the back of a t-shirt as well. So your front of t-shirt, it's about your intentions. It's about what you're wanting. It's that aspiration. But the back of your t-shirt represents how we walk our talk. So my first question to you is, think about your front of t-shirt word and now write down, and can we launch another poll? Yep. Sorry, not poll, word cloud. What might you see on the back of your t-shirt? I love that, rolling eyes. Reliability, there we go. Then we can see front and back. Care and resilience. Co-production, how interesting. Non-judgment. So what behaviours do you think people might see on the back of your leadership t-shirt? It could be, I'd love that they're seeing accountability. So we're actually seeing that happening. It could be that inspiration and integrity. It could be the care, the resilience, complying, being supportive, being inclusive, listening and collaborating, working harder, being a good listener, being non-judgmental, problem solving, being inflexible. Thank you to that person for being honest as well, because sometimes it's hard to actually notice what's on the back that we're not proud of. And a lot of this we are proud of as well. And I think it's interesting that inflexibility and rolling eyes have landed together as well. Someone also wrote about having your back. Be interesting what would be on the front of that person's t-shirt and what does actually mean. Cut the crap. I love that one. So I wonder on the front of t-shirt, what would be for that one? Cutting the crap. That's often where we go to. I've often heard of people saying listening's on the front, cut the crap on the back. I don't have time to get to this. I need you to speak openly and quickly, or I need you to tell me what I want to hear because we need to move on. Is that really listening? So we've got more words coming through here. Reliability. Being transparent. Smiling. What a great one. Blocking. I wonder if that's something to think about as well. What blockers are you putting up so that other people can't actually demonstrate their front of t-shirt? So sometimes we actually go there as well. We become the blocker. Desire, hope and fairness. The big words coming through: care, respect, honesty, accountability. So for those of you that are writing these words, I hope you're really proud. And then also to have a think about what that could look like as well, so that your front and back are aligned. Because on the back, we want the real behaviours. We want that focus as well. Come on, we can do this. That's a great one to have on the back of the t-shirt. Approach me. You can talk to me. I'm going to listen. I'm here for the team. Yeah, thank you for the person who's written scared of change. I think that's really real. And sometimes we need to own that. And I think, as I said before, that actually brings a lot of strength, strong leadership, showing that vulnerability as well. What do we do to mask it? And there are words about problem solving, being able to be that person who's positive. I love that idea of front of t-shirt is positive, on the back of t-shirt, well, we always hear about this person complaining or finding that broken component. And what does that actually look like? So as we think about these, we've still got lots of words coming through. Thank you for sending them. Have a look at what other people have written as well. Could any of these words be on the back of your t-shirt? And what does that actually look like? Self-doubt. Thank you for sharing that as well. I wonder what that actually looks like. How does that show up? We probably see it a lot. And sometimes we try and mask it. And sometimes we just need to be able to share that as well. So we've got some really strong words here. And some of them are negatively correlated and some of them are positively correlated. They're all linked to leadership. And I think that's what's important as well. Sometimes we want these words that are strong to actually stand by us on both. Thank you, and thank you. Go to the slides. So if you think about your intentions and the front of the t-shirt and the behaviours, now we're going to actually look in your work environment and think about what your values are. So take a moment to actually think about what we saw, the doing and the behaviours. So just take a moment before we move on to write down your front of t-shirt and anything you need to do for your back of t-shirt to align. I think sometimes just being aware what's on our back of t-shirt is enough, and other times we actually need to start creating that change. Now this is the values for the Dental Health Services Victoria. And I know not everybody here will be following these values. You might have your own values around you that in your community or within your team that you've created. But I invite you now to do the same activity. So these words are great. They're so powerful. And we've heard them been spoken about already. Respect. Take a moment to think about, what does respect look like? I often hear respect means putting the phone down and taking that time eye to eye. And then I hear from somebody else that, no, actually having my phone there actually enables me to be more present and available because I use a certain, might be a long straw, but I use something on my phone that enables to be here and now. But I think what respect is having the conversation. Collaboration. And I think in what we've gone through over the last year, we know that as part of what we do as leaders, the value of other people's words. Accountability. I think that word has stood up more and more. Being accountable. What does that look like? If you have accountable on the front of your t-shirt, what's on the back of your t-shirt? If we're following you around and seeing you being accountable, what would you like other people to see? And then I challenge you to go and ask others to see if that would work. Then we've got transform. And I think that, you know, that word that we all use during the year about pivoting in this unprecedented time, I know I wasn't meant to use that word, but that's what happened over the year. So if you think about transform on the front of your t-shirt, what would that look like? And then think about the values that you subscribe to at your workplace. Is there a word that you could come together to look at behaviours? So when I spoke about the Navy before, well, what they did is they actually had their back of t-shirt, what they wanted to see on the back of their lanyard. So when they had a communication on the front of their t-shirt, on the back of the t-shirt, it actually showed the behaviours that was respectful communication. And they went a step further. In New Generation Navy, they actually wrote down what it wasn't. And I wonder if you could also consider that. What are the behaviours we don't want to see? And what can we do about it? Going back to that concept of conflict and disruption, challenging norms. Today might be a day for you to start thinking about the culture, the norms around you. Values is how we live our culture. Back of t-shirt is what's most important. Every one of us can be very, very happy with our front of t-shirt. The hard work is the back of t-shirt and what that actually looks like. And we'll be able to share these slides with you as well so that you can have them to actually work with your team as well. And finally, before I wrap up this session, I wanted to ask you to consider something firstly about yourself. What have you learnt about yourself today? And I love this concept of your WWW. You may have heard it's not the World Wide Web. It's a great question to ask at the beginning of a meeting. It's a great question to ask it yourself at the end of the day. It's a great question to enable your constructive thinking. What is working well? So what we normally do is we go to the list of all the things that we need to be fixing, all the things we're not doing well, all the things I should have done better. I should have known more about this. I could have done this way. Where we know that becomes a negative cycle. And it's actually not good for our brains. We're not going to be our best when we do that. So what we need to do is actually think first, what is working well? So think about the exercises that I took you through today around leadership, management, values. What are you doing well? Take a moment to write that down. And then you can go to your EBI. Sorry, EBI is even better if. Now, if you're sitting in a meeting and the first thing that happens, everybody asks, how's it going? What are you bringing into the meeting? But you stop and you say, what's your WWW? And then ask everybody, what's your EBI? You're actually going to land on a very strong place because we're building on what's working and we're doing that quality improvement. And then finally, can I challenge you all? 30-day challenge. Pick one thing in your EBI or one thing on your WWW that you would like to create more of so that you can continue that as well. Because I think if we choose one step, then we can start measuring that as well. Now you can see that I'm very passionate about leadership. And before I wrap up, I just wanted to give you some insights about why we do what we do as well. So, Women in Leadership Australia, we've just celebrated our 16th anniversary, and we're very passionate about increasing leadership and equity in leadership for women in workplaces. As you would have heard before, the Australian School of Applied Management sits above that. Women in Leadership Australia is a very important brand, and it focuses on this. No, it doesn't focus on that. Can you move a slide? There we go. So we have this reminder, and I think in your news feed, your daily news feed, this will become even more apparent why this is important. When I started doing this work in 2005, Australia ranked number 15 as part of the Global Gender Gap Report with the World Economic Forum. That means that we were being measured on those 4 areas: economic participation, political empowerment, health and survival, and educational attainment. And you can see we were ranked 15 in 2005, and now we're down to 44. And I've also highlighted our closest neighbour, New Zealand, and they're sitting right at the top, and they have been continuously. So Australia's not doing very well. Women in Leadership Australia has a focus on shifting these numbers because we don't want to continue going backwards. McKinsey and many others have created many reports to show that it's not just about women being in leadership roles that it's going to fix everything or make things different, but it's about ensuring that our workplaces reflect our communities. Our leadership teams reflect our communities, 50% women. Now we know that there's so many other platforms of diversity, but gender is like the canary in the coal mine. It shows us that we don't have diverse workplaces. Interestingly, educational attainment, Australia is number 1 in the world, but we fall down on the other areas that bring us down to 44. Now, what's happened in COVID the last year has actually made those figures even more stark. We know over the last year that we've called it the pink pandemic. More women have lost jobs than others. More women are employed in the sectors that are first hit by the economy. Greater domestic violence and also greater domestic burden. So we've had lots of challenges for women, and we'll send you that link that you can be part of this research, part of University of Queensland, because we'd love to get your data as well. And what that actually looks like. So what do? Well, we celebrate the work that's been done in the leadership space, but it's definitely not about fixing women. Catherine Fox, who I encourage you to read and find out about, published so many books that are so interesting, but this one in particular, this one really stands out because this one is all about understanding that it's not a deficit model, that women don't need fixing. It's about bringing women together and creating more networks, creating more visibility of female leadership. And today you're definitely getting some strong views of that. So we hold conferences where we have thought leaders, we have networks build. We also have a new membership platform, and we're going to send you opportunities to be part of this as well. To tap another woman on the shoulder to say, maybe it's now your time, or put your hand up to say, this is time for me to think about a leadership development program. Bain and company have done some amazing research to show some of the challenges with diversity is that a lot of women don't actually do the development work for themselves, don't put themselves forward. And because we're so delighted to be working today with you all, we've actually created an opportunity where we're offering partial scholarships. And there's a landing page where we can send you with lots and lots of information to answer any questions. And we'll follow this up on Monday as well, so that you'll be able to have a look at, maybe it's for yourself, maybe it's for somebody else, so that we can get more women into this space. And just before I finish up, Thank you. The word for 2020. We did this across all the organisations that we're working. The word that we had was disruption. The words that stood by it were chaotic, change, unprecedented, pivoting. But before we finish today, I would like you to consider, what is your word for 2021? Do we have time for another? Yeah? We've got one more. So we're asking you for what's your word. If you think about, as we've gone through this conversation today, think about your year. What's your one word to describe 2021? What's the word that you want to aspire to? So that if we were standing here today, next year, in a year's time, you'd say, yeah, I'm really happy. That's where we got to. What is the word that's standing out for you? It might be to do with your leadership. It might be to do something connected to your values. It might be something that you've made a big decision about that you're going to be doing more or less of. And this is going out to everybody, and it's starting to come back to see what are the words that we can create for 2021 as we come through this amazing turbulent year. I love that we've got hope standing out. I think we need to hold on to hope. You know, there's a whole hope theory that holds us very steady. Opportunity, transformation. Oh, look at that word, reconstruction. Being vulnerable, being able to hold that. Yes, being post the COVID era. Know my worth. Grounding, transition. Evolution, what a great word. Peaceful's coming through very strongly. Positives, change, grounding. Tired, oh boy. We need to have a think about that. If that was your word, I encourage you to be really proactive to ensure that that doesn't become the word of the year. Consolidation is standing out. We've still got opportunity and hope as the ones leading the way. Blossom, what a beautiful word. New beginning, redirection, determination, success, rebuilding, self-reflection, having time for self. I think that's something that we've all learnt. Moving forward, independence. We've got equity, excitement, lucky. Innovation's coming in there as well, which is a great word for today for sure. Consolidation, change, and opportunity and hope is still standing out as the big words. Being positive, how important is that? Salubrious, love that word. Being lucky, being grateful, being able to move forward. Yes, we're aware that there's distraction and stress, and I think sometimes it's important just to know that that's there. New ways of thinking, doing, and being. It's been such a pleasure to be with you today. Thank you for taking the time to think about who you are as a leader. Thank you for considering what your values are, what's important for you to be moving forward as well. And as I said in the very beginning, and I think we've heard this consistently, whether you think you are or you think you aren't, you're making an impact. You definitely are making an impact. So think about that video camera. How do we see you? And what can you do to ensure that it aligns with what's most important to you? And let's hold that word for opportunity and hope closely. Thank you, everybody. Thank you, Sue.
I'd clap.
Thank you.
There's hardly anybody in the audience. Thank you, Susie.
Oh,
that was
thank you.
absolutely fantastic. I think there's lots of challenges in there for us, but also lots of opportunities for us to work through some of the work that you've presented for us today, so we can actually all continue on that leadership journey. So thank you so very much, and thank you for your generosity in relation to the scholarships. That's amazing. Everybody will get that information out to you next week, so that you can see how you can participate in that process. So
And
thanks
thanks
so
for
much.
demonstrating strong leadership.
Oh, thank you.
Thank
Pleasure.
you.
Okay, folks, we're going to move on now. So I think some of the great words that came out of there were hope, the kindness, the calm, the safe, the compassion, all of those things are such important things in our leadership journey. And I think also the ability to show vulnerability was one of the things that we all learned a lot about in 2020, because it wasn't something that any of us knew anything about. So we had to be vulnerable so that we could actually learn and learn together. So thank you, Susie, for that fantastic presentation. In 2019 and 2020, DHSV developed a clinical leadership program. The program was designed to give experienced clinicians the research skills to identify a clinical problem, then undertake a research program to develop a solution to that problem. Each participant in the program undertook a research project, and 4 of them are here today to explain what they learned and how they went about it. So the people that will be presenting for you shortly is Dr. Uma Ravandran, Dr. Harisha Kalapatha from RDHM, Dr. Anjali Regard from Echuca Community Health Services, and Dr. Una Raikuga from Shepparton. And the final presentation at the end of this will be from Dr. Ruth Heredia, who will wrap up the session speaking about her leadership journey so far. So I'd like to hand over now to Uma to give us some insights into what the program actually delivered and what they went about. Thanks, Uma.
Pleasure. All right. So thank you for inviting me to speak here today a little bit about my presentation on the Clinical Leadership in Oral Health Practice program. I'm going to talk a little bit about my peer review project. Let's change the slide. Change. There we go. Okay, so a little bit of introduction. As Sue said, my name is Uma. I'm currently one of the senior dentists at the Royal Dental Hospital. I work predominantly in the teaching clinic, but when I started this project back in 2019, I was working as a primary care dentist, mainly in emergency. The aim of my presentation today is to hopefully show all you guys when we work in public health or population health or any health industry, we should always be questioning, are we doing the best we can and can we do better? Chances are if you think there's something that we can do better, you're probably not the only one. And even if you are the only one, it's still an idea worth discussing with your colleagues, with your friends, with your managers, people in other community clinics and other health industries as well. See if they've come across similar problems or similar issues and how they've dealt with it and how they've made it better as well. So the project that changed. There we go. The project that I did along with my colleague, Cetra, was to try and revamp how we did peer review in the primary care department. We'd have regular sessions and regular meetings pretty much every month where we would discuss cases and often have speakers in from the specialist department come and talk to us about different things, like we might have the oral surgery team come talk to us about how to assess and manage the swelling. We might have the endo team come talk to us about how to manage complex trauma cases and changes in guidelines. We might have the PEDS team also talk to us about how best to support a patient that's going for general anesthetic. But what we felt is that peer review could be more than that. It should be, a set of those collaborative activities to review and support our professional and clinical practice, and also improve that quality of patient care. So to really differentiate between peer review and, let's say, a case study or a case presentation. I guess the other reason that we were really interested in doing this project is we wanted to create a platform where we could talk about our cases and we could talk about our experiences, things that went well, things that didn't go so well, issues that we had in treatment planning, or difficulties we had managing patients as well. And we wanted to try and do that in a blame-free platform, so to not have any negativity associated with it. And actually that's really easy to say, come up and tell me about your case and no one will criticize you. But as we all know, that takes a little bit of a culture change, and I'll talk a bit more about that in a little while. The other reason we wanted to do this project is we wanted to really get back to what a team was in primary care. Like I said, we did have regular meetings, but they were very clinician heavy. So we'd have, dentists, prosthetists, OHTs, but the rest of the primary care team weren't involved. And we felt that primary care team is more than just the clinicians. We really wanted to bring the DAs in as well. We want them to feel part of the team, respected and empowered enough to speak up for safety and patient-centric care. So as with any project, it starts with a proposal, but to get any project off the ground, you've got to have buy-in. You've got to have enough people backing the idea and agreeing with you and willing to kind of cheer you on. We were really lucky from the offset. We had our director backing us up and the senior clinicians. But you've got to have the rest of the team as well for the idea to kind of get any steam and get any progress. You've got to have enough people cheerleading you on. So for us, that started with conversation. So we talked to our colleagues, the rest of the team, what do you think of peer review? What does it mean to you? What have you done in your other clinics? What have you done in other practices? Would you be interested in hearing other people's cases? Would you be interested in sharing your own as well? From all that information, and also speaking to other community clinics and to other hospitals like Peter Mac, we put together a proposal what we would like for peer review with our aims and objectives and our scope of the project as well. We presented that to our director and she signed off on it, allowing us some time off clinic to prepare for that first session. Before we even did that first session, what we did is we did a survey of the team to try and find out again, kind of a baseline vibe of what they thought about peer review. Change. There we go. So from all that, we pulled together our pilot, and our first peer review was on clinical incidences. And the reason we did that is that from the survey, we got a vibe that people firstly weren't sure what would classify as a clinical incident, and they weren't sure how to navigate that VIM system about submitting a clinical incident as well. The other reason we picked it is we wanted to try and showcase things that had gone wrong for us. We wanted to stand up there in front of the team and say, look, here are some things that happened to us in clinic that didn't go so well. Let's learn from it. We're showing that, we're vulnerable, we're far from perfect, and this is that blame-proof platform. So you don't need to be worried when you're talking to us that we're going to be criticizing you or saying anything negative. This is all about being constructive and being better. So the first peer review we did was in February 2020, so just before COVID hit. So we got the team together, we presented our clinical incidences, we had opportunity for questions and feedback as well. The next few sessions were obviously post-COVID, and this threw a little bit of a spanner of the works. It's a whole new medium we have to work with, and it was very daunting for us. Are people going to be engaging on a screen? Are people going to have connectivity issues? What kind of response would we get? But actually, it turned out really well because we were able to record the sessions. It was less intimidating for people. We could access people that were working from home, and people could watch it in their own time as well. So we had some sessions on radiology interpreting, speaking up for safety, some endodontic incidences, and prescribing as well. And this was kind of all based on the feedback that we got from the team about what kind of things would interest them as well. Here we go. So like I've said kind of throughout this, that evaluation and feedback was really important to me because although we were doing this as part of a project for the clinical leadership program, this is something that I am very passionate about. And if it's something that the team wasn't responding to or they didn't find any value in it, then I needed to change it to make it more worthwhile of their time. We had some really, really good feedback. We had lots of positivity on the team. They enjoyed coming to the sessions. They enjoyed working together with the DAs. They felt more comfortable working together as a team clinically. They found it a really useful resource. But as with any feedback, particularly when it's anonymous, you'll get the good, you'll get the bad, and you'll get the ugly. And some of the less positive feedback that we got were things like, I didn't think the DA should be involved. I thought the presenters were immature. I thought the cases were interesting. And that's fine. I'm happy to get negative feedback because I'm not going to get better unless you tell me what I did wrong. But what we did call out and what we did ask for is, if you're going to give me negative feedback or criticism, be constructive. So if you don't think the DA should be there, tell me why. If the cases aren't interesting, what would interest you? If you think I'm too mature, tell me why. And that's just how we evolve, and that's how we'll move on to the future. And I guess now that the pilot's over, the next step is continuing peer review and expanding it. So bring it to the whole primary care team, not just primary care on the first, like on the general clinic, but also to bring in the teaching team. So to bring in students, to bring in the university, to bring in the specialists as well, particularly on those cases that we share together. So in emergency, you might see a lesion, you end up referring to oral medicine. What happens to that patient? Is there anything we could have done differently? Is there something we should have done better? So I guess that brings me kind of towards the end of this. In summary, I guess I have a few different points. Firstly, that change can start with a simple idea, and just because it's simple doesn't mean it won't have a huge impact on your team. Secondly, try and be open to change. I know we all get really change fatigued and it is exhausting, but think of it more as an opportunity to improve the service that we're giving our patients. And finally, try not to take change as a negative reflection of yourself. Just because somebody suggests to do something differently or a change in ideas doesn't mean that what we were doing before wasn't good or great. This is just something new. Let's try it. Let's get some feedback. Let's evaluate it. And let's see what the outcomes might be. To finish off, I guess I'd like to thank all you guys for listening, and special thanks to the primary care team, so general care, teaching, and emergency, for all their patience and support for me over the years. And if anybody has any questions or comments, feel free to reach out to me on my email address. I look forward to hearing from you. Beautiful. I just walk off. Oh my God, that's over.
So hi, my name's Heshani and I'm a paediatric dentist at the Royal Dental Hospital in Melbourne. Today I'm here to present on my project of developing a social story for our department. Today I'll go through what a social story is, its benefits, its effectiveness, and the process we went through to develop one for our department. A social story is a behaviour intervention that is mainly targeted for children with autism. However, they also have been shown to be helpful for children with learning and intellectual disabilities. They generally comprise of a short sequence of pictures and sentences that describe a situation. So on the slide there, I've given you a sneak peek at what the final product of our social story is. So children with autism, as we know, have a deficit in social communication, difficulty developing relationships, and have an altered response to sensory stimuli. So providing dental care to paediatric patients with autism can be very challenging. Additionally, they are also at an increased risk of dental caries and gingival disease. The aim of a social story is to encourage development of a desired behaviour, to eliminate undesirable ones, and to prepare the child for a new experience. The advantage of using a social story is that they're relatively inexpensive, easy to use, and a non-invasive technique to aid behavioural change. However, as children with autism are not a homogeneous group, individuals will likely respond differently to interventions, so social stories are not going to be effective for everyone. Research looking into the effectiveness of social stories in the dental environment, even though quite limited, have been shown that about 60% of parents have found it useful for themselves and their child. Interestingly, a study by Marion back in 2016 has also shown that these children prefer to interact with social stories in a digital format rather than the standard paper format. So why did we initiate this project? Mainly because of the high proportion of special needs patients we see in the paediatric department. We were keen to help prepare both patient and parents for their first visit, in the hope that this would improve cooperation and enable us to conduct the most thorough examination as possible at that first visit. A pleasant experience for the patient also makes it easier for us to develop that key relationship with the patient and the family, and allow us to more smoothly guide them through treatment and will improve compliance to recourse post-treatment. So we started off the process by recruiting Spencer and his family for the project. We created a simple script about what will commonly happen at their first visit and took pictures that best describe the situation. So pictures included photos of reception, of the dental chair and clinic, the dentist with their PPE on, pictures of the dental instruments, Spencer lying back in the chair with his mouth open and hands on his tummy. And we also included pictures of Spencer having a prophy, having x-rays taken, and finishing off with Spencer leaving the dental chair all happy after being praised on what a good job he has done. We then recruited families with autistic children to be part of consumer testing. We tested 3 prototypes to ask for feedback. So we tested a video which was created by the Children's Hospital about visiting the dentist, the social story we created, and thirdly, a vocabulary card image. We wanted to compare styles and effectiveness. Each prototype had 6 quick questions, and at the end, they were asked to rank the prototypes and tell us about their preferences. The goal was to validate or invalidate our design, determine what level of detail is required for this cohort of patients, and to determine if the social story prototype could stand alone. We sent some of the consumers a link to the prototype survey, while others filled in the survey during their dental visit on an iPad. So social story passed consumer testing with 7 out of 8 parents saying that they would use this with their child. All the testers found it easy to understand and the language very respectful. Families told us they were very familiar with social stories and it was an important tool that they already used at home and at school. With regards to video, parents said it was good, but autistic children could find it difficult to follow. They commented that the combination of both sound and the visuals could be overwhelming for their children. With regards to the vocabulary card, Parents said that even though it could be helpful, there was often too much variation between the cards and what the clinician said, making the interaction that little bit more confusing. So with the social story, even though families were happy with the design, they did make some great suggestions for improvements. Things like having more people in the waiting room, showing the dental assistant and dentist in the same space, describing the sounds that Spencer would likely hear at the appointment. Another good one was to let Spencer know why the dental visit is so important. So we were really keen on getting Spencer back with his family, back to retake some of these photos to incorporate these recommendations from the consumers. However, during this time, COVID hit, and it wasn't appropriate to bring the family back into a hospital environment just to retake the pictures. So we instead did have to change our plans a bit. So instead of a photo-based social story, we did a comic-based social story, which allowed us to make all the necessary changes. Overall, we got great feedback from parents. As mentioned before, most of them were very familiar with using social stories already. To allow the social story to be accessed by our colleagues at the community dental clinics, we have incorporated the hyperlink to the new pediatric referral form. So it's dhsv.info/social story. The form also has additional questions to be completed by the parent and the child, which will further help us tailor their dental visits to their needs. Thank you for listening, and we encourage all referrers to discuss and provide the hyperlink to the families of dentally anxious or special needs children so they can use it prior to their visit at the dental hospital. I would like to thank Joe, who was our consumer experience and co-design consultant, for helping do this project with me, and Dr. Andreasen Cocker for his support. Thank you.
Hello everyone, my name is Anjali Ragde and I am here to present on my research topic, oral health care in rural antenatal women, which I carried out as part of my clinical leadership program run by DHSV. At the outset, I'm really grateful to DHSV for giving me such a large platform on which I can present my research. Thank you. So a little bit about my background. I work in a small border town of Echuca, which is in the Loddon Mallee region at the junction of the New South Wales and the Victoria border. So that is my alma mater, Echuca Regional Health, and I have worked in that public dental department, which you can see on the right, for the past 8 years, and I have enjoyed myself tremendously. Coming back to my project, oral health care in rural antenatal women. So you will probably want to ask, why did I choose this project? Well, the reason is, I believe the mother is the central unit of the family. You educate the mom, you will educate the whole family, and you will directly benefit the kids. So I started thinking, in our public dental clinic, we used to get pregnant women only in their last weeks of pregnancy, and we used to mostly get them just for emergencies. Even if we prioritized them, because they were not motivated, they would discontinue treatment after delivery, and many of them would remain as open courses of care. So I thought that if we were to motivate them and get them in early, in the first few weeks of pregnancy, we could finish all their treatment by the time they delivered, and the project idea was born. I then did a fishbone analysis. I found a number of factors which could be responsible, but I decided to focus on just 3, which you have seen here highlighted in red. So they were that patients were not aware that they are priority patients and hence do not have to go on a waiting list for treatment. There was lack of awareness within other medical practitioners about the referral pathways, and pregnant women were not being hence actively engaged by other service providers to look after their oral health. So I prepared and presented a project proposal While working on that, I realized that my project actually aligns very closely to the DHSV principle of value-based health care, as we were not only talking to them about preventative measures, but also improving their oral hygiene and talking to them about their education, rather than just drill and fill techniques. Mentors, I could not have asked for better. Both were really senior and extremely knowledgeable in their professions. With Dr. Werner, I gained immensely from his invaluable experience at DHSV and also as a senior clinician. With Cynthia, I learned a lot from her expertise in research, and she was an immense help right from the ethics application to collection of the data to writing out the results. So thank you very much. I did and got an ethics approval. I prepared my solution design using SMART principles. I started my project using the change management principles using change champions. These are my project highlights. So my target population was pregnant women in the ERH catchment who had valid concession cards, healthcare or pensioner concession cards. My key stakeholders was ERH maternity services, the enhanced maternal care programs, the private GP clinics, obstetricians and midwives in the private sector. The duration of my project, the baseline period was from December 2018 to September 2019. The intervention period was from December 2019 to March 2020 and from June 2020 to November 2020. For a period of April and May 2020, the project was paused due to COVID. The methodology was we made referral form templates, gave them to the midwives and asked them to give them and motivate the pregnant women to come in for dental checkups. How did we do that? In Jan 2020, we had a meeting with DHSV representatives Jillian Lang from Oral Health Promotion and Stephanie Thautrap, midwives from ERH Maternity, Karen Taylor and Brooke Simmons, and ERH Dental, which was represented by my practice manager Kamal Beck and myself. We identified that there already exists a program which helps the Victorian midwives to get oral health information which they can give their pregnant women. 10 midwives from ERH Maternity were already trained in this program. So I had a ready pool of motivated and engaged stakeholders who were valuable to my project. So this is the program I was talking about, the Midwifery Initiated Oral Health Education Program that DHSV actually sponsors, and it helps midwives to provide oral health promotion, assessment and referral in the pregnancy booking visit. From this meeting, I got invited to present at the ERH Obstetricians Audit in February 2020, where I gave a PowerPoint presentation to midwives from the public and the private sector, local GPs and obstetricians, and motivated them to start referring pregnant women to the clinic. On the left, you can see a letter that I drafted to all the local GP clinics explaining about my project and requesting for their help. On the right is the referral template that I made for the midwives, and I sent it to them that they could use to refer pregnant women. So they would give a copy to the pregnant women and they would fax us a copy, which we would then follow up by calling them and motivating them to come in for checkups and also further follow-ups. I kept in touch with the midwives by further and regular emails. So this was generally my project. The antenatal women came into the clinic, saw the midwife. She was asked if she had a concession card. If she did, she was referred to us, the public dental, where we saw her as a priority patient with no waiting. We completed all the treatment she needed, whether it was intervention or prevention or oral health education. We then gave her a plain language statement explaining our project and asked her if she consented to be part of our project. If she said yes, we got her to sign a consent form and we included her data in our project. If she was not happy, that was fine. She still got all the care she needed. If the pregnant woman did not have a concession card, she was referred to a private dental clinic. Unfortunately, we couldn't follow her up after that. Conflict resolution, the most important factor, COVID. Work was paused for almost a couple of months. When it started, it was emergencies only. Elective treatments were not possible, and even the GPs were reluctant to let the pregnant women back into the clinic for fear of catching infection. Rightly so. Eventually, the project got completed in November 2020. The results are here for all of you all to see. As you can see, we've got really stupendous results and we were thrilled. Overall, we saw a statistically significant increase of 168%. So in the baseline period, no referrals were made, 17 women came into the clinic, mostly to have extractions, and a small amount of 20 preventative treatments were done. In the follow-up period, 62 referrals came in, 44 of them were actually seen in the clinic, which is 70%, and 96 preventative treatments were carried out. So that we were really happy. So the engagement rate of the eligible pregnant women jumped from just 15 in the baseline to 40% in our intervention period. Sustainability, it's very important because without sustainability, we will end up solving the same problems again and again. So how did we try for this? Is continuous motivation and education of the stakeholders. Then we used good leadership, which is positive reinforcement and support, and change in the process like quality improvement audits. So what are my key takeaways for you all today? One, the pregnant woman is the most important unit because she is responsible for cultivating habits in our family. DHSV has already recognized it. They have given her priority status. However, because it is not possible or there is no current targeted referral system, they are being missed. So the chain is already there, but it is disjointed. It needs to be linked together. Acknowledgements, I can't even cover them in one slide, but the entire clip hop teaching team at DHSV and Gillian Lang for kindly providing me the slides for the midwives. Both my mentors, Dr. Werner and Cynthia, the ERH dental team, my practice manager Kamal Beg, doctors Adrian and Anil, and the rest of our dental team. ERH maternity services, health information services at ERH. On a personal note, my dear friend and colleague Anupriya Raikar and my better half Anil Ragde. Any questions, please feel free to direct them. This is my email address and I will be happy to try and help in whatever way I can. So once again, thank you so much for listening to me and have a good day. Thanks.
Hello everyone. My name is Anupriya Raikar and I'm here to present about my project Halls Technique Stainless Steel Crowns for Primary Dentition at Rambala Aboriginal Cooperative Dental Clinic. I'm grateful for this opportunity given by DHSV as a part of Clinical Oral Health Leadership Program to carry out this project, and it had outstanding results. I would like to begin my presentation by acknowledging the traditional owners of the land, pay my respects to elders past, present, and emerging. Rambarara Aboriginal Cooperative is a health service in Murupna. I've been working here as a dentist for nearly 10 years now, and it's a beautiful place to work with, surrounded by gum trees. And I thoroughly enjoy working there. As my experience has been, I have been noticing most of us have some form of dental anxiety when it comes to interventive dental treatment. Avoidance to come to dentist is not very uncommon, and it results in either needing extensive complex treatments for the Aboriginal population, either to be referred them to be treated under GA. However, it does not address the problem to come to the dentist early on. And this got me thinking as to, is there a way where treatment can be atraumatic, give better results, and also give an opportunity for the prevention of and oral health promotion and improvement, especially when it comes to children. This led to my project idea, the use of Hall's technique stainless steel crown to manage multi-surface carious lesions in Aboriginal children ages 3 to 12 at Rumbalara Aboriginal Dental Clinic. Why, you may ask, I chose this project? Well, the Hall technique has already been proven to improve compliance in young children. It reduces dental anxiety. The technique is evidence-based, relatively atraumatic to children, and also a high-value treatment. If children accept this intervention, it will build trust and open up an avenue to do early preventative treatment and improve oral health outcomes. So I went deep into to gather some of the data, which showed the statewide use of Hall's crown technique was nearly 52%, whereas at Rumbalara Aboriginal Cooperative Dental Clinic, it was only 23%. There was less emphasis on preventative treatments and more complex treatments were carried out. The issue was not addressed before, and that's why we did this project and it showed the positive results. Despite of the challenges we faced due to COVID and staff changes, we could achieve a threefold increase in this technique in just a span of 12 months. It went up from 23% in 2018-19 financial year to 77% in the financial year 2019 and 20. So we had this traumatic way of dealing with this treatment intervention, however, we are not doing it as much. So here is how we turned that around. Going into my project methodology, I did more analysis into the impact of the problem. Stainless steel crowns were performed at Rumbalara Dental Clinic. They were really less as in the financial year 2018-19. Traditional restorative techniques took more clinical time. Anxious children missed appointments and were referred to the treatments under GA, and there was need for cooperation of the patient to undergo traditional treatments, which can get tricky at times. And we also identified the lack of oral health awareness leading to secondary caries, abscesses, leading to referring them to GA for complex treatments. So I set up three goals, the three main goals for this project. That is, to increase the percentage of multi-surface carious lesions managed by Hall technique stainless steel crowns from 23% to at least 75% as treatment intervention. Prevent progression of initial lesions, improve oral health literacy among the children and their parents, and in fact into the community. I am really grateful for my mentors for supporting through this project, Dr. Martin Hall and Sharon Richardson, who is a dental therapist at RDHM, for their immense guidance and support, and the entire DHSV Clip-Off team. I couldn't thank enough for my own dental team at Rumbalara Aboriginal Cooperative and my friend, Dr. Anjali Ragde, who has been also doing the project with me as a part of Clinical Oral Health Leadership Program. So going into my study design of the project, we held lots of team discussions, which was based on evidence-based practice. Demonstration to the technique to other clinicians were done, and the appointment slots were booked according to this project. There were preventative strategies such as fluoride applications and oral hygiene instructions and fissure sealants. We had to make posters, handouts, referencing oral health hygiene education and stainless steel crown information and oral hygiene questionnaire. So this is how the technique looks like. We showed and got concept from the parents about the stainless steel crown. We got the child to get the separators placed, and in a couple of days, they came back to get the crown inserted. And during this phase, during the separator phase, I did some preventative measures such as oral health literacy questionnaire and education, did some fluoride application, fissure sealants, and handing out oral products to use. So this was the tools that I had to use for this project. The oral health questionnaire, which was really beneficial to get the conversation going. It gave an opportunity to have that open conversation between the families. For example, how does fluoride toothpaste help? And what are the healthy snacks to choose? So giving ownership to the child to choose healthy foods and drinks. I made these posters and handed out flashcards, which then, give them the ownership to choose the healthy diet as part of their snack and things like that. Oral hygiene products were given, and I created this culturally appropriate brushing chart and other handouts to give out. Overall, the outcomes as measured by cervix mix reports on the titanium over a 12-month period showed increase in preventative measures along with the Hall's technique crowns after commencing this project. It went up from 9 to 30 in 2019 and 20 year. And data showed increased percentages of also the fluoride treatment, diet advice, oral hygiene instructions, and fissure sealants. The key benefits of this project was it had positive impact on the interventive treatment on young Aboriginal children, and the whole team really appreciate that. They could see the change. The clinicians reported ease of technique for better time management. They reduced complex treatments such as extractions, GA referrals. It reduced dental anxiety among the kids, and it improved oral health awareness among the community. And most importantly, I found the children were happy to come back to dental clinic. So what future holds? Sustainability is important for any project to continue. This project is still ongoing and it's going with positive outcomes. There is need for more funding into oral health literacy projects. There's need for oral health educators and the clinicians to follow evidence-based practice. By right stakeholders buy-in, we can all achieve extraordinary results. Having conversations is important to identify key stakeholders, engaging everyone in the team to seek, to listen, and understand the needs and requirements. It is about managing expectations and to lead with integrity. This is what led to my project. If you have any questions or any conversations that you want to have, you can contact me on my email, which is up on the screen. And I would like to end my presentation with this quote, which I'm sure everyone will resonate with. If not you, then who? If not now, when? By Hillel. Thank you very much.
Good afternoon. So, you won't be hearing about a completed project like these wonderful clinical leadership program graduates that you've just listened to. You're listening to a project that has just started a new chapter and will continue for a little while. It's my year-long journey I'm embarking on through a Victorian leadership program to learn and improve my skills as a leader, hopefully embed some of my learnings in my workplace, and also I'd like to support other leaders, young leaders, in that process. Today I'll leave you with 3 ideas to ponder about leadership in your life and what it means for every person in the team, not just the official leader. For your reference, at present, to give you some background about myself, I work at a community dental agency, Access Health, and hold positions of leadership as the senior dentist and the director of private practice. I also work at DHSV, and I hold the position of Director of Clinician Engagement, working with clinicians, and part of the Chief Oral Health Officer's core team. People ask me, what's clinician engagement? So it's working directly and indirectly with management and clinicians to remove and reduce all the hurdles to clinicians just getting their job done well. Additionally, I'm really interested in how older leaders can be guides for younger ones. This was something that happened in my career in the early stages. I wish there was more of it, but at least I wish to pass it on. I've been in leadership positions quite soon after graduating, and also in my non-work life. I'm not going to recite my CV. You're capable of looking at that on LinkedIn if you're curious. If you were with me in 2004, what you'd hear me say is, dentistry is great, but I'm a bit bored of just dentistry. Maybe some of you can understand that. I'm sure you'll agree it's still very rewarding to change someone's smile, to relieve pain. It's really powerful stuff that we do. I love it. But I also wanted something more. So last year, I applied for the extremely competitive Williamson's Leadership Program run by Leadership Victoria. I was delighted to be accepted and honoured to also be offered a scholarship position. So why was I chosen? I wasn't quite sure. There was elation, but there was also some self-doubt. You see, at Williamson's, as a participant, you're around board directors of companies, CEOs, not-for-profit executives, directors of large portfolios, owners of startups, people with long, fancy titles that sound powerful and intimidating. And the question arises, well, why am I here? By the way, they did warn us about it at Leadership Victoria, this imposter syndrome. But the question still came, how do I fit in? What can I do? What can I teach these people? What do I bring to the table that has value? And what does leadership in my sphere look like? It started me thinking about what makes a leader. What does leadership look like? We can have these ideas that leadership is about changing big things, changing organizations, leading a company, changing the world. And it is, or can be. But it also is and can be changing our world, the world around you, influencing the people in the world around you, the people in your team, the person next to you, and the person who is you. So here's my first thought for you. How do we experiment with the idea that we may have the capacity to facilitate positive change by being a leader just in our own sphere, regardless of whether you hold the title or not? Can you imagine the impact we can have on each other if we made that step in a respectful manner, but without necessarily having the power or the title? I'm experimenting through the Leadership Victoria course myself. I hope to be a great leader and also seemingly paradoxically a better team player in reporting to my leaders. One of the ideas we've been exploring all through today is what good leadership looks like. As you hear me speak, I'd encourage you to consider these concepts in the light of your workplace or your life. So you'll hear 3 areas that I've been introduced to at the program so far, and I think you might find these immediately helpful. The first one, manage self first. I learned that involves leading or managing myself first and foremost, before others. What does that mean? I think it means to know and understand your strengths, your vulnerabilities, and triggers. I'm sure you all know people, maybe it's you, who get upset easily or are quick to see their weaknesses in others but cannot see their own failings. It's like we have a blind spot. Being aware of your vulnerabilities and triggers can help you perform better in life and work by managing your reactions, not just reacting impulsively. Triggers are things that set you off. Perhaps it's when you feel unrecognized for a contribution, or if someone else always speaks over you at meetings. If you're unaware of what triggers you, these triggers can cause you to react in an unproductive way, rather than think, process, and act constructively. On a personal note, since pondering this, I have come to accept and celebrate more the talents that others have that I don't. I've grown welcoming of the team's joy and strength rather than sitting there wishing I had a particular attribute. And you know what? It makes me a more settled person, able to act rather than react. The second point I'd like to share is see around the corner. Don't just react to the matter in front of you. I'll tell a story about this. Allow me to introduce a wonder dental assistant we had at our clinic. She was everywhere, across everything. She was proactive, a team player with humility, while being the overseer of operations and clinic needs. Importantly, she thought ahead. If things were not going well, she'd take it upon herself to think of a way to ensure it didn't happen again and engage the team with it. All of her own initiative. She was never an official lead, because we don't have that position, but was a leader in everyone's eyes in the clinic and held the respect and admiration of the whole team. So you don't have to have the title to be the leader. The last one, this one's a bit challenging. Surround yourself with a diverse group of people who think differently from you and ask good questions of them. You'll never know what you'll learn that can open up a different perspective on an issue. Ask questions respectfully about why and how people think differently and consider their responses. You may be very surprised at how that contributes to a sense of understanding, belonging, and even friendship sometimes that draws a team together. In closing, I would exhort you to be courageous to express new ideas and experiment with new ways of being in your team. I've heard a leader isn't good because they're right. We can't be right all the time. They're good because they're willing to learn and to trust in the whole process of failing, trying, failing, learning. This isn't easy stuff, especially leading and managing yourself and being open to different ideas. But like these clinical leadership program graduates and all the leaders who have spoken before me today, I encourage you to take a journey to stretch and try something new and possibly change your world and maybe even that of those around you. Thank you for listening.
Thank you, all of you, for stepping up to the plate and sharing your learnings with us today. Thank you for showing true leadership. Many of you, I'm sure, felt the fear, but did it anyway. If there's anything in the conversations that the team have had with you today that you think that you could actually implement in your area, please do so. Please call out and have a conversation with the team so we can actually spread these fantastic learnings across the state. The final speaker for today is Sheena Watt. Sheena is a member of the Victorian Legislative Council for the Northern Metropolitan Region. She's the first Aboriginal Australian woman to represent the Australian Labor Party in the Parliament of Victoria. Prior to becoming a Member of Parliament, Sheena was an Executive Manager at AFL Sports Ready and on the Board of Directors for some of the most important community organisations in Victoria. Sheena has an extensive experience in Aboriginal affairs, health and employment and has a strong commitment to advocate for those who face poverty, discrimination or disadvantage. She's committed to breaking down structural inequity and creating and supporting healthy and connected communities. Sheena is going to provide us some insights in being a leader in the Indigenous community, so I welcome Sheena to the stage.
Ready? Thank you so much. I'm really delighted to be here, and thank you Dental Health Services Victoria for hosting today's conference. And Sue, for that very warm introduction. I'm a little overwhelmed hearing it, still all these months later. Of course, as is my cultural custom and protocol, I begin by acknowledging the traditional owners of the land upon which we meet, and for me here, I'm on Wurundjeri Woiwurrung country, and I acknowledge their elders past and present and thank them for their continued stewardship over this land that I call home. And I understand that we've got people here from right across Australia, so I encourage you to take a moment to acknowledge and reflect on the traditional owners of the land upon where you are. Of course, I can't be at a conference with dental professionals and speaking about my leadership journey without acknowledging and paying my respects to Dr. Chris Burke. And he is, of course, some you may know, he's Australia's first known Aboriginal dentist and former Minister for Aboriginal Affairs in the ACT Parliament. Dr. Chris Burke is someone who has been a quiet giant in the world of Aboriginal and Torres Strait Islander health and wellbeing. And I reflect fondly on our time together in Aboriginal health. And of course, prior to this new job that I have no doubt that he will continue to be a champion for many years to come in better health outcomes for Aboriginal and Torres Strait Islander communities, in particular in the dental space. And so I'd like to encourage those of you that don't know of Chris Burke to learn a little bit more about him, his incredible story, and if he's on the line, I encourage him to put pen to paper and write a book, because it certainly would be one worth reading. Of course, in acknowledging someone long-standing and in quite a profound part leadership role in Dr. Chris Burke, I can't then not look to emerging leaders in the dental industry, and for that I say, Steph Throwtap, you are something special, and I'm really honoured about our friendship and how it's grown in our work together over the last couple of years. I first met Steph through my previous work in Indigenous employment, and I know just how much she wants to champion stronger Aboriginal and Torres Strait Islander outcomes in Indigenous employment, and I am very much looking forward to doing what I can to continue to support that in this new role. And I think about the work that we did, bringing awareness of racism to the staff of Dental Health Services Victoria now. I think it's 2 years ago where I got my hands on a hot copy of the very powerful documentary on Adam Goodes. Some of you may have seen that. It's a very, it's a tough watch, I'll say that. And the staff of DHSV, in their boldness and vision for being an organisation to not only be on the reconciliation journey but challenge themselves to be bolder and braver, decided that they would join me in a screening of that Adam Goodes documentary, and we learnt a lot then about racism and what it looks like in our community, and we've seen that it still continues on, and I'd love to say that it's finished, but racism in sport is of course a symptom of a much broader cultural and social issue right across our state but also our country, and I'm really devastated that I'm standing here today the night after a football game when Aboriginal players were racially vilified again. And that's something that sort of shook me a bit today because I wasn't expecting that. The fight for equality and justice never stops, and I'm glad that on this journey are many people. Of course, I want to talk about leadership, but it's also there's so much more to it than that, than just being a leader. It's not something that I kind of expected, and now I'm being told I'm a leader, which is news to me, news to my community, and absolutely news to my mum. And so with that, central to leadership is of course listening, and I can't do this job without stopping and listening and thinking about the way forward, not just in our journey but also in the way we do business. And that's why I just thought to reflect on some of the important work that DHSV is doing on the co-design framework. That has been brought to my attention. It's something that I am so happy to see, which is an idea, as bold as it is, that people with lived experience inform the path forward. And as somebody with lived experience in inequality, particularly in dental care, I think this is enormously helpful. Some friends often wonder about all these little spaces that they see me in, and they hear that I've got some great connection to it, because you can't live a life of disadvantage and hardship without coming up against some pretty tough challenges. And for me, as a young person, that included access to quality dental care close to home. And in fact, it's the importance of Aboriginal community-controlled healthcare that I want to reflect on today and think about, because as we heard from the previous speaker, in an Aboriginal community-controlled health service, they're so critical to very strong outcomes for dental care for Aboriginal Victorians. I remember it like it was yesterday, walking into the Aboriginal Health Service in Fitzroy. It is sort of seared on my mind. And I went there for dental care. because it was just so hard to find some place that was not only accessible, but it was culturally safe. It was a safe place for my mum to bring me and to be able to talk freely and honestly about the challenges of, accessing dental. And so it was so stark for me, that experience, that I thought of all the life experiences that I wanted to discuss in my inaugural speech. What were the things that really framed up who I am and what shapes my values? That it included that time that I went to the Victorian Aboriginal Health Service seeking urgent dental care. And that just says something about the depth of my passion for this. Is you don't get to get up there and deliver an inaugural speech on all the things that you want to talk about. But what I did talk about that day was my experiences accessing urgent dental care through Aboriginal community-controlled health services. And so I just wanted to share that with the viewers, to say that this is in fact something very, very dear to my heart. And of course I am very much a strong supporter of your new work in co-designing a future framework for the service that empowers patients, staff and community, and those in leadership roles to work in collaboration, of course in partnership with technical experts, and also looking at lived experience as a part of program design. I think about some of the previous work that I've done, and how it would have just been so much easier if from the very beginning we had people with lived experience in the room to share their ideas and insights. Of course, this work is about the Smile Squad. That is actually very, very exciting, and I haven't raved on about it enough today, and I could go on for quite some time, but really it's parents groups that allow parents, guardians and carers to have a say in the way dental care is delivered to children and young people in schools. And the fact is that it wasn't delivered right for me when I was a young girl. That's why I went to the Victorian Aboriginal Health Service in a point of desperation and profound need. And the fact is that seeing that that's been so tackled, so right, with the real values of people with lived experience embedded into this work, it's just quite incredible. And I find myself trying to phrase the words, and I've got them written down, but I'm too connected to it and feel too emotionally impacted by those hardships of my early years to not say to you, thank you so much for doing this work. And it really does make a very big world of difference. And it's just part of all of the work that you do. And I need to think about and reflect on your reconciliation action plan. It's been going for a little while now, just over a year. And what have I got here, in late 2019? But it was before that that of course I worked firstly with DHSV on the work around, building up cultural safety in the sector, and of course that will continue now more and more into the future as you go to realise the ambition of your RAP, and I congratulate you on that. Of course, placing a lived experience central to your work, not only for all your patients, but for also Aboriginal and Torres Strait Islander patients is so critical, and I really do commend you to that for that, and that it's based on an understanding and a real value of self-determination. So I acknowledge that and pay my respects to you for your work. Of course, you asked me to talk about my own journey, and I want to do that. And of course, I talked a little bit about being younger and the fact that I missed out. I missed out on things that young girls shouldn't miss out on, like healthcare, like school experiences, like, going to school camps and other things. But that really shaped me in who I am now as an adult, and I made a very conscious decision as an adult to look to my lived experience to shape not only my value system, which of course it does, but also my career path and the things that I decide to do every day when I get up. And whether that was my experience and work in health and trying to close the gap in health outcomes for Aboriginal and Torres Strait Islander people, whether that was around employment and the fact that I grew up in a family with insecure employment and that led me to working in youth employment outcomes, or more broadly in Aboriginal affairs. I've always aligned my values to my life experience, and now I see this latest role as just a further extension of that I can bring lived experience, not only about myself, but people I know, people in my community, and you know, people from my background. And I'm not just talking about people that are Aboriginal. I'm talking about people that are women, yes, and I'm also talking about you know, people experiencing vulnerability and disadvantage and doing it tough. So I really appreciate just how welcoming and supportive those communities have been to me, the fact that they will disclose and share their story with me, the fact that they feel like there's somebody who understands and somebody who listens and somebody who acts. And, you know, it's not that I got to hear by being that person magically overnight. I was a person that people spoke to, confided in, and expected to act for many, many years. And so I would just say that it is an enormous privilege to have people share with you their vulnerability, but also their aspirations for their future. And that's something that I think has really driven my leadership, is not that I do it for my own gains. I really do it so that I can look back and say, for people who came to me, for people that spoke to me, and people that were vulnerable with me about their life and circumstances, I listened and I acted. And that started a really long time ago. And, you know, on Monday I'm going to talk to some grade 5s about my leadership journey that began in primary school. You know, the very first time that somebody said, can you be a representative for me, and can you be a representative for us? And it's just sort of continued on from there. Of course, I not only had hardship and disadvantage, but a lot of that came from a health system that failed me and my family. It meant that I was a carer, that my mum was a carer, and that that was me. I'm getting a bit emotional, so I'm trying to keep it together. So yes, and I don't want a health system that fails people like it failed us 30 years ago. And of course, you know, a 9 to 5 wasn't enough for me, and I knew that I had greater ambition for making an impact than in my day-to-day. And from 15 years old, I have been appointed to and elected to community organisations, and many members of the Aboriginal community will be familiar with it, whether it's your local health service, your youth group, your action group, or your traditional owner body. I've been involved in many of those over the years, and I'm very grateful for those experiences because they grounded me and centred me in Aboriginal cultural knowledge and doing. The particular experiences that I want to talk about was my first ever win, because I thought that for a little while that maybe some of these communities you just talk an awful lot, and they made me think, why am I doing this? Is this really worth my time? But it was the thrill of the win that, and I'm not just meaning like win like a sports win, I mean that that I was part of a group that made sustained, long-term cultural change in my community. And the fact is that the group that I was involved with lobbied hard and advocated hard for the saving of historical sites of cultural significance. These were sites in my local community that were a place of gathering, they were a place of knowledge, and they were a place of immense sacred value, and they were at risk of being destroyed. And I thought it wasn't enough that we in that committee room be angry about it. Others had to be angry about it too. And so we got the word out and spoke to our leaders, spoke to our elected officials, spoke to our local councillors, mayors, local members of parliament, and said, you must save this. It's too important for not only us as an Aboriginal community, but for the landscape of the cultural identity of this place, that it be saved. And indeed it was. And that was my first win on a board, and I remember it very, very clearly, and it really has shaped you know, my long-term commitment to work in this space. And so I, as was said in the introduction, have been a member of a number of community organisation boards, and not just in Aboriginal affairs, in broader health, whether that's community health services, statewide peak bodies, you know, research groups, advisory councils, and all sorts of things that meant that I could, in fact, make my voice heard. And I can say that it was a place of profound cultural isolation a lot of the time. You know, for many years I was the only Aboriginal person in the room. It prepared me well for Parliament, I will say that. You might not be familiar with the makeup of the Parliament, but indeed I am now the only member of the Victorian Parliament that is Aboriginal or Torres Strait Islander. So I thank those experiences. They taught me a lot about myself and my own resilience. And I'll of course look back to and make sure that not only am I making an impact in that room, but that I continue to have structures around me that provide me with the sort of supports that I need to stay strong and stay resilient. I think about the fact that there's some really hard debates in this Parliament, some things that really challenge my value system, and they challenge my cultural identity. They challenge my my beliefs every day. I think the fact is that the first thing that I do every day when I go to Parliament is watch another member of the Parliament disrespect my cultural practice and protocol. It happens every single time. This doesn't go unnoticed. But for me, I say, it's not okay. It's not going to stop me. It's not going to stop me from every day going in there and speaking truth about the life circumstances and impact that the legislation that we're debating before us has on the lives of Victorians and Victorians from my community, the Northern Metropolitan Region, which have all sorts of you know, complexities, but also beauty in their diversity and strength and their resilience. And I like to share those stories about the history of the people of the northern suburbs, and also about the impacts that this legislation will particularly have on everyday people. And I'm really proud that I try my very best, it's not always possible, to share the stories of people with lived experience of that particular issue, whether that was last week when I spoke about spent convictions and what that means, which is that, you know, you can spend a lifetime with a criminal record for something that happened when you were very young in this state. It doesn't in fact happen in other states, and that's something that, you know, we've now stopped. But what that meant is that Victorians weren't given the opportunity that other people in other states were, and when we're looking to have the voices of people with lived experience in the room where decisions are made, that includes people with lived experience of connection with the justice system, and that wasn't going to happen while we didn't have a spent conviction scheme. So I'm really proud that in fact has now changed. And I heard the story of the young woman who got up a great number of fines because she just had moved in from regional Victoria to city Melbourne, and didn't really understand what that was all about. And by the time she'd worked it out, thousands of dollars of fines were in front of her, and a career in health was on the line. She turned her life around and wanted to give back to her community by being a health professional, but potentially wasn't able to do that. And that's why the very quick interventions that were made by legal professionals were so important. But not only that those interventions shouldn't have had to happen, because we should have a system that recognises that sometimes you make a mistake when you're young and you can get past it. I am, fortunate that I didn't make those mistakes so that I can be in the Parliament, but people that I know, people that I care about, are in the Victorian and wider Australian justice system in various ways, and their lives are impacted each and every day by decisions made when they're younger. Their ability to get employment, seek housing, it has a really profound impact. But what I'm saying with this is, and I feel like I'm going all over the place, but what I am saying is that lived experience for me is really foundational to the work that I'm going to do as a member of the Legislative Council and the Victorian Parliament. And it's the true stories of people like Sally that moved to the city, that made some mistakes, or whether it's or people like me that didn't get it right when they were younger around getting access to medical care, and it's impacted them all these years later. I know that we will be a better Victoria, we will be a better health system, we will be a better community if we continue to embrace lived experience in not only legislation in the Parliament, but also in the way that we develop and design policy and programs for better health outcomes for all Victorians. So I am entirely going to never stop raving about the importance of people with lived experience. Having been on consumer committees and consumer engagement committees, community advisory committees for many, many years, it's something that really shaped me and my leadership journey, and I'm very grateful for that. And I am very much looking forward to continuing to support organisations, people, leaders, and other Victorians that embrace the story of Victorians each and every day. So I could go on for just about forever, to be honest, and I'm waiting for someone to give me a TikTok time thing, not the app TikTok thing, because I'm not going to do a silly dance, but I'm very, very grateful to be here, and I thank you truly for this opportunity. And it is in fact cultural in its grounding, the importance of lived experience. I'll say that it is in fact a cultural practice that we listen to our elders, that we listen to those that came before us, we listen to those that know better, and I am just grateful that it's taken a little while, but finally the rest of Victoria has clicked on to the wisdom of First Peoples and their knowledge of respecting and honouring lived experience of people that have gone before. So thank you so very, very much.
Thank you, Sheena. Thank you so very, very much for that. Thank you for bringing your lived experience to us today, but also thank you for bringing your vulnerability for us today. That's it's hard to do, and it makes us all cry a little bit. So thank you so very much.
Pull it together now.
Yes, exactly. And have a great afternoon.
I will too. Thank you.
Wow. Some amazing insights in there from Sheena. I think the thing for us, a couple of people that you called out there, were Dr. Chris Burke, who actually chairs our Reconciliation Action Plan Working Group and who is a true champion, and also to Steph, who actually runs that program for us and who is so excited about taking the next steps in our journey to implement long-term sustainable cultural change. So thank you for those fantastic words and for your generosity today. So, well, everybody, that brings us to the end of today's conference. Thank you all for your participation. I hope you enjoyed the day as much as I did, and I've taken away some great ideas around how you could change your practice back in your local community. There's an evaluation form that's popping up on your screens as we speak. I would encourage you to fill that out now, do it now, so that we actually can get some feedback from you about what you took out of today, but also what you would like to see us deliver in the future. The Innovations Conference will continue to occur every year. Hopefully, crossing fingers, we may be able to do this face-to-face this time next year, which would be really exciting. There will be a link for those of you who'd like to review the program today. There'll be a link sent out to you next week, and you'll have a week or so to actually have another look at what we produced for you today. So thank you for attending. I hope you have taken some innovative ideas out of today's conference, and we will continue to work on improving leadership across Dental Health Services Victoria. So thank you and have a great weekend.